We're live.
We good?
We're good.
I'm going to call to order the Calaveras County Board of Supervisors regular meeting for January 26, 2021. We have one item on closed session. Conference with legal counsel, anticipated litigation, significant exposure to litigation, one case pursuant to Government Code 54956.9 D2. Board action. Ms. County Clerk, do we have any public comments? Can we give it a moment and we'll see if anybody calls in?
Yes, Chair Stopper, we'll look right now. At this time, there does not seem to be any public comment.
And we'll give it a few more seconds, just in case there's interested parties. And we'll take it back to closed session. Thank you.
Thank you.
So now we log out and log into the other thing. Oh boy. The meeting now. Would everyone please stand with me and take the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, and liberty and justice for all. Boy. Excellent. Stacy, Ms. Clerk, can you please report out on closed session?
Yes, on closed session, item 1, conference with legal counsel, anticipated litigation, significant exposure to litigation, one case, pursuant to Government Code 54956.9 or D2, no reportable action by the board.
Thank you. Next, we have staff announcements. This is a time for county staff to provide updates of upcoming county events that may be of interest to the public. Do we have any staff announcements?
Yes, Chair Stopper. Happy New Year and good morning. And welcome Ms. Wallendorf and respective board members. Lisa Medina, Environmental Management Agency. Our animal service team will be holding another free microchip event on Friday, February 12th and Saturday, February 13th in honor of Valentine's Day. The time sets will be from 10 a.m. to 4 p.m. In addition to the microchip event, we will also be holding adoptions to find forever homes. Did you get it? Forever instead of forever? Anyhow, for those that are in our care. The adoption fees will be $14 per pet. Please come out and see us. We will even have treats for the humans. That is all I have. I can take questions.
I don't see any hands up right now. Is there any other staff announcements? Okay, with that, we'll move on to the public health update. The public health services will receive an update presentation from staff on COVID-19, novel coronavirus.
Have I been let in? There I am. Okay. Is the video picking up?
Sam, we can hear you.
Now you can hear me, but the video is not coming in, huh? There we go. Okay, it rebooted on me, so I apologize for that. You guys can hear me okay?
Yes, we can hear you.
Great. Well, thanks again for affording me the opportunity to partner with the board and help lead us through this unique time in human history. We're taking a really balanced approach to all of this, and we've been clear that there was a lot of uncertainty from the first time I updated the board on January 12th. We were clear about how unclear things were and how this would improve over time. And it is improving over time. And so I looked back this morning at my notes from January 12th, from January 19th, and when everything is right in front of you, it's easy to lose sight of how far we've already come. As for the numbers, today we have a total of 1,598 total cases over time. We have 93 active cases. We have 1,482 recovered. We've had 23 fatalities. And we have 4 active hospitalizations. We were moved, the regional stay-at-home order was removed by the state. It was lifted on January 25th, yesterday. And we're now back to being in the purple tier that we were in before the regional stay-at-home order. That means that we can have outdoor dining. That means that places like hair and nail salons can reopen with modifications. And for the other things, I'd encourage you all, if you have questions, to go to the government's Blueprint for a Safer Economy page and look at what those specifics are. To date, and I will talk more vaccines as I go in, but just leading into it, our data dashboard, which can be found at covid19.calaveras.gov.us. Our dashboard now has the total number of vaccines given, administered, and that number is now up to 2,080. A week ago, I reported it was 919. So we've come a long way in a week. Out of those 2,080, 1,835 are first-round vaccines. 245 are the second dose. So as you can tell, a lot of first-round doses. Now those second-round doses are catching up to us, working through a lot of those. Same story, I assume, at Mark Twain. But I'm going to try to be a little more organized this time, Doug, and run through what I've got to run through first, and then turn it over to you at the end so that I don't confuse everybody again. Testing is still important. We've done, Public Health has done 507 tests since December 23rd, not counting what's being done at OptumServe. I will say that this week, today, we have testing at Ironstone. Tomorrow we have testing at the Armory in Copperopolis. And then, of course, there's still the OptumServe site in Sonora. We're still in a surge. It has exceeded our capacity. However, we're still doing investigations, we're still doing contact tracing, and we're still doing testing. Testing continues to be stable. As far as our testing rates and case rates, because I know there's a question about, we're in the purple tier, how do we get into a lower tier? We are statistically a ways off from that, because right now our test positivity rate is about twice what it needs to be to get down into the next lower tier, which is the red tier. Okay, so I will update on that every time that we come back, and of course in between if somehow we make it to a lower tier. But for now, that doesn't look very likely within the immediate future. Okay, so before I get into vaccines, because I know that's the big topic to address today, I just want to remind you guys that prevention is still the best defense. Wash your hands, wear a face covering, and practice physical distancing. If you're sick, please stay home. Please isolate from others. The best way for the public to help is by not getting COVID. And the best thing you can do to improve your chances of that are the things that I'm mentioning. Okay? All right, let's get into vaccines. So, I'll remind everybody that, even coming into the January 12th board meeting, 2 weeks ago, we were just beginning our partnership with Mark Twain. Mark Twain hadn't even started vaccinating the 65 plus yet. That was 2 weeks ago. Fast forward to today, and these guys over at Mark Twain are doing a fantastic job of trying to get as many people in. But the demand is incredibly high. You know this. If you're a member of the public, if you're a board member hearing from members of the public, if you're me hearing from the board members and from the CAO and from the public, you know that there is more demand than there is supply. And that always creates a little bit of fear and a lot of frustration and frankly some anger. And we understand all those things. Now, I was thinking about it this morning and I was reflecting on comments that were made at the state yesterday. And the analogy that was used was that it's sort of like loading an airplane. And it's, trying to determine who is getting the vaccines when is a structured process through the tier system that I will read off this morning. But it's like loading an airplane in the sense of if you're loading first class and then you're going to wait till absolutely every single passenger in first class is on the plane before you move to business class. And then you wait till every single one of them until you get into one of the other boarding groups. You're going to take hours and hours to load a plane. So we want to do things in an orderly and equitable way. And at the same time, we have to balance that with being as efficient as we can. In other words, we also want to get as many doses into arms as quickly as we can to make sure that we work toward that herd immunity that we all want to have. So it's the balance of those two things that I say we're taking as balanced an approach as we can. As quick as we're getting supply, we're administering the supply. Doses come in every week, doses go into arms every week. And that's what we're doing. And we're working with Mark Twain, we're working with our medical community, we're working with the state tier system, and we're trying to get through all that. Only the problem is, in the analogy I gave you of loading an airplane, we're not really loading an airplane. And if we are, the airplane is about the size of a football stadium. Because if we have roughly 2/3 of our population that we need to vaccinate, we're looking at 30,000. And then there's 2 doses. So just round numbers, 60,000, right? Maybe it's 55,000 in the end because maybe, you sort out some of the under 16 that aren't eligible. So if we have to get 55,000 doses in arms, and so far we've done 2,000. So we're not loading an airplane, we're loading a football stadium. And it's a football stadium full of people who need to be fed. And we only have so much food to give them. And that is the task at hand. So we're trying to do things as orderly as we can and as equitably as we can while following the state tier system. There's just only so much supply. So last week, we got a total of 700 doses in toward the end of last week. This week, we've been promised 100 doses. It doesn't mean that we won't end up getting more. Sometimes we do. But right now, that's what we've been told. So if 2,000 doesn't grow to 60,000 overnight, just understand it is a supply issue. And everybody's fighting to get into that football stadium. We need to work together. And we need to be in this as a team. Okay, so what are we doing this week? We're continuing to vaccinate emergency responders. We're continuing through 1A. I'll read off 1A to you because there's been some confusion out there. 1A includes healthcare workers. It includes long-term care residents, acute care, psychiatric care, correctional facility hospitals, skilled nursing facilities, assisted living facilities. Those are the facilities that are contracted to be done by CVS through the federal contract. And similar settings for older and medically vulnerable individuals. 1A also includes paramedics, EMTs, and others providing emergency medical services, home health care, and in-home supportive services. So we're still working with the IHSS folks. Community health workers, public health field staff, primary care clinics, urgent care clinics, correctional facility clinics, other settings and healthcare workers, specialty clinics, laboratory workers, dental and oral health clinics, pharmacy staff not working in settings in higher tiers. So that's kind of our phase 1A. Some of those people have just gotten a first shot. A lot of those people are coming back in for second shots. There's a lot of coordination happening. Those are the things being coordinated by public health. At the same time, going back to the analogy of loading the plane, while we've got them moving, Mark Twain has been working on phase 1B, tier 1, which is the individuals 65 and over. So those folks have been getting their first dose over the past week and a half. We also have in that same tier those at risk of exposure at work in the following sectors: education and childcare, emergency services, includes emergency response, food and agriculture. Obviously, we can't vaccinate all of those subgroups at once. So we're working our way into phase 1B. The priority from the state has been to work with that 65 and over population. And the most recent expectation from the governor is that once we get through that tier 1 of phase 1B, that we will be prioritizing by age after that. In other words, from our more aged population working down in a systematic way. So these changes come very quickly from the state and they expect us to respond. A lot of times we have our schedules already mapped out for a week, week and a half, 2 weeks in advance with things that are already planned. So if you've heard something about, oh, well, I believe they strayed from this tier or went in this direction, these things are mapped out. When the state makes an adjustment to their tier schedule, we also make that adjustment. But the state also understands that we don't make those adjustments overnight. If you're scheduled for your appointment tomorrow and the state makes a change today, we're not going to call you and cancel your appointment tomorrow. Right? We're going to change things from the point to where we move forward. Right? So if that's a week and a half later from where we're not scheduled out anymore, that's where we make the change from. That's obviously been a very difficult balance for us. We understand the public frustration. We're as frustrated as anybody with the frequent changes. We've given that feedback to the state. We want clarity as much as anybody. We really don't like being caught in the middle of that. At the same time, we're working as hard as we can to make sure that we distill and clarify for those of you in the public. So hopefully some of this is helpful. So getting back to this week, we're continuing with 1A, which is that first tier. And then we're continuing to work with the 65 plus over at Mark Twain. We're supporting CCOE in getting their folks vaccinated, which is in that phase 1B tier 1. And we've also started with childcare workers this week, which is in that same tier. A lot of people are probably wondering about the food and ag because that's at the bottom of that same phase 1B tier 1. So they're on our radar, and as we work our way into February and we get the folks that I've already mentioned set up, we'll be working to get registration systems going and make sure that we're prepared for the food and ag group. I can't give you a concrete timeline for when that's coming, but roughly I would hope that we're getting there by March. Really depends on supply. Okay, you know, when we get told to vaccinate all the people in these groups by the state, and then we get a supply of 700 followed by a supply of 100 over a 2-week period, and frankly, Mark Twain through Dignity Health gets whatever supply allotment that they get, which isn't what they request, right? They get what they get like we do. You know, we can only move so much and we can only project so much. And I understand your frustrations with me and our lack of clarity. And frankly, I just don't want to overpromise anything to anybody and start making promises about when we're going to be able to vaccinate food and ag when we haven't gotten through the other parts of what leads into that. Okay? So we will communicate every single time that we get up here, as we have been doing. But understand, it's a football stadium. 60,000 people packed in. We've gotten 2,000 so far. We've gotten them into arms. We're doing the best we can. All right? With that, we know registration has been difficult and confusing. Talking about registering over at Mark Twain, I'm going to let Doug speak to that in a minute, but I just want to put it up there. We're working to solve that. Mark Twain is working to solve that. The state has also announced, quote, My Turn online system. We don't have all the details we need to have on that. As usual, the state has made an announcement and details are to follow. So we will see what that system brings. In the meantime, we're working to make sure that by the time, you know, right now, the folks that public health is vaccinating are what we call pods of people who are being invited in. It's orderly. These are specific subgroups. We're reaching out to them. We know how to reach them. We get that word out. We invite those people in. By the time we get to a more open process where we need people registering, we will have an online registration process for that. Okay? Mark Twain is working on that as well. But we also need to balance that with what the state is putting up. So if the state isn't able to hold up their end and execute what they need to do, we will make sure that things are orderly by the time it's your turn. Right now, continuing to work through the groups that I mentioned earlier. One side comment I want to make is there have been a lot of questions about, if I get the first dose, how do I know I'm going to get the second dose? We're committed to that. We've been very conservative about that. We're making sure that we have a second dose supply. Now, there's some miscommunication at the state level and in other counties, and frankly, some have made decisions that are slightly different than what we've made, and being really aggressive and expecting and just hoping that the second dose will show up. And then what happens? Sometimes that second dose doesn't show up. We're committed in Calaveras to make sure that that second dose is accounted for at the time that we give you the first dose. We want to make sure that people are getting their second doses. Okay, last thing I'm going to say before I turn it over to our partner Doug Archer is just, again, we're taking a balanced approach to this. We want our residents to be safe. The board members want you guys to be safe. Wear your masks. Distance. Wash your hands. Avoid large gatherings. We want the people who want the vaccine to get vaccinated. We're working through it. It's a football stadium full of people. 60,000 doses. We've gotten 2,000 in. We want our kids in school. I've gotten some questions about why we're vaccinating teachers. Well, because we're following the state tiers. It's in Phase 1B, Tier 1. And frankly, our community wants our schools open. So those things align. And we're proud that we've partnered with our schools to make sure that our teachers are getting vaccinated. And I wish them well. We want our kids in school. and we want our businesses open. You know, so all of these things play together. We're all in this together, and we need to work together and build each other up. Okay, this is a difficult, monumental time. I'm sorry if my tone is a little dark today. I'm clearly feeling a little bit of the pressure, and I'm happy. I know what I signed up for. At the same time, I want to make sure that we're not just clawing at each other and pointing fingers all the time. Okay? We're trying to be as accountable as we can for things. We're trying to work countless hours around the clock, do the best we can to bring you the best service we possibly can, all right? And we're in it together. With that, Mr. Archer, can we turn it over to you for an update from our wonderful partners at Mark Twain?
Thanks, Sam. Yeah, so I think the thing that is going to get us through this interesting time is the partnership. I think we're doing pretty good about building that partnership prior to the pandemic, and I think we've really hit stride in the past few weeks. So I appreciate all the help from the county, and you know, you mentioned clarity, Sam. So I had a chat with my leadership team here the other day. There isn't clarity. So we expect clarity, we want clarity, but we also have to be willing to admit or digest the fact that there just isn't clarity right now at all levels of the nation, and how we, not only how we move forward, but what resources we have to do so. So we'll get back to that. So real quick, here's what's going on in the hospital today. We have a pretty high census, although it's not due to COVID. We have a census of 15. We have 4 positive COVID patients. 3 of them are in med-surg. 1 is in our ICU. That one in the ICU is on a ventilator. So what that means in terms of the ICU capacity number, which is kind of the gold standard metric, we have 3 patients in our 8-bed ICU. So we have a little over 60% capacity left. So we're actually doing pretty well in terms of ICU care. The ED visits have been actually going down a little bit. Yesterday we only had 23 patients in the ED. Our average is about 30. So probably some of that had to do with the weather. Wasn't easy to get down the hill yesterday. So that's kind of the high level of where we're at the hospital right now. So let's switch to vaccines. We are also holding so that we can guarantee that second dose. I agree with Sam. That's an important thing for us to do. Supply chain is definitely the biggest concern here. I just talked to our pharmacist right before this call, and we are also hoping, I don't have confirmation, so I want to be very clear about that. We are hoping for another 100 doses this week from the Dignity Health supply chain. With the help of our good partners at the county, we are able to get a few more doses from them, and we will be hosting another vaccine clinic Thursday and Friday this week. Right now, we know we have 400 doses to give. If I get the 100 from Dignity, then we'll give another 100. But right now, we're planning on 400 doses between Thursday and Friday. Because of the weather, we're going to do a short day on Thursday. Keep in mind that a lot of this vaccine clinic activity is outside for social distancing and things like that. So when it's windy and rainy, it's not so fun. So we're going to do a half day on Thursday and a full day on Friday. Just to emphasize the supply chain issue, our clinic 2 days last week gave 300 doses a day. And without too much pain, I think 300 is a pretty easy pace for us. But we can't do 300 a day when our supply is only 100 a week. I think anybody can, do that math. So supply chain is definitely the key. I'm hearing a lot of positive things and some optimistic comments from, our leaders at the national level. And I'm hoping that translates to more vaccines showing up at either the county or at our hospital. I can tell you that I think Marina Bolin, our clinic director, and the entire clinic crew has done a great job. Very efficient process. And we gave 860 vaccines last week out of that clinic. So that's the good news. The challenge remains managing our wait list. And there's just no two ways about it. We are not used to getting 12 to, best estimate is we're up to about 15,000 calls at this point due to vaccines. We've got roughly 5,000 people on our wait list now. Just to kind of give you a benchmark, throughout the entire year, all of our clinics see about 35,000 people. That's about 3,000 a month. We've gotten 15,000 calls in the past 2 weeks. So, this isn't a woe is us and feel sorry for us. It's just the sheer magnitude. So the other thing that I want to stress here, and this is maybe not the best customer service statement, but when people call in and we aren't able to schedule them right away because we don't have a vaccine to give them, they're going on a wait list. They need to understand that that's a wait list. You're going to have to wait a little bit until we have more vaccine. I think the big challenge that we had, and I spent a lot of time chatting with some community members over the weekend about this, is the way it kind of unfolded. So a little more than a week ago, it was 2 Fridays ago when we published our scheduling number. Of course, we were inundated with calls. Many of those were voicemails because, the phones wouldn't turn over quick enough. And so I think I mentioned this last week, but within 15 minutes, we had almost 1,000 voicemails. And if you can imagine the couple of people that we had available to kind of staff those phones, they're getting calls quicker than they can check voicemails. So chronologically, it didn't work out the way I think most people would expect it to be, meaning I was the first person to call, I should be the first person scheduled. Technology just didn't work that way. The first person to call was a voicemail. And then when we went to check the voicemail, we got a live call. So there was it wasn't a really smooth flow for us. And then also keep in mind, if we have 5,000 people on our wait list and we've only given 860 vaccines so far, that's, almost 6,000 people total, wait list and vaccines. 5,000 of them are disappointed. 5,000 of them didn't get a vaccine. I do understand that. I understand the anxiety around this. But what's really important is really just having patience and bearing with us. We also did not, we're working on some solutions here, but we did not want to pull our staff from scheduling and from our normal operations. Keep in mind we're still running clinics and hospitals for non-COVID care. We didn't want to pull those staff simply to call people that were on the wait list to tell them that they're on the wait list, because that doesn't move us forward as a community. I understand it can release some of the anxiety for that person that has the confirmation that they know they're on the wait list, but it's not as productive. So I understand the anxiety, I really do, and the frustration / anger that can cause. So here's what we're trying to do to solve that problem. We don't have the staff to pull off to call 5,000 people to confirm they're on the wait list. However, we are working very, very quickly, hopefully, there's 3 different vendors that we're looking at We should have proposals from all three by end of day today. And we would have them essentially call our wait list and confirm with those individuals that they're on it. Best case scenario, we get those three proposals today, we make a decision today, we sign the agreement today. That group probably wouldn't be able to start that work until the end of this week at best. So we're going to have some more frustrations from our community, and I'm very prepared to take that. I have broad shoulders. I'm more than willing to be the target here. That's okay. The good work right now is getting people scheduled to get in for vaccines. So we've had a lot of, which has been phenomenal. We've had a lot of requests or offers to volunteer to grab that wait list and start calling people. We still live in a world of confidentiality, and although, there's been some suspension of some HIPAA elements, we can't just bring people in off the street and give them a list of 5,000 people and their personal information. So, although we do appreciate that, it'd take us about 2 to 3 weeks to get somebody through the screening process, to validate, to do the background check and all those things to where we could actually release that list to them. If we're still dealing with this list in 2 to 3 weeks, we have bigger problems. So we're not putting our energy into that right now. We're putting our energy into finding a partner that can help us call those people on the wait list to reduce that anxiety while our staff stays focused on the real goal, which is getting patients scheduled. Again, 400 doses this week. Slim chance that we might have 100 more for a total of 500 doses this week. And then we're going to wait for more vaccine supply. One really important thing, and if everyone on this call can help us out with this, I learned over the weekend that there was a report or a rumor that we had lost a lot of calls and a lot of information when this number first got published for scheduling. Not true. We have a lot of voicemails and a lot of people that we haven't been able to get back to confirm they're on the wait list. But our system did not, it did not malfunction. We didn't lose any voicemails. We didn't lose any data. So that might be part of the anxiety that's out there. So if that can be repeated as much as possible, that would be very helpful. So the good news is we have a really solid process in our clinics. We can give 300 doses a day if we have the supply to do so. We've got a great partnership with the county health department. I think it makes a lot of sense. We stick with that 65 and over patient population. Let the county work on the essential worker type categories. I think it makes a lot of sense. That 60,000. When you say it like that, Sam, it really, gives me a picture in my head. But you're right. It's about 60,000 doses that need to be given. And if we're on a path of 300 a day from our clinic, let's just forget about inventory and supply chain. It's 1,500 a week. It's going to take a while to get to 60,000 on that trajectory. Couple other really quick things. So I'll update you guys as soon as I have information on who we've been able to select to make those kind of auto dialer robocalls to the wait list so that they know they're on it. And then we expect, conservatively, I'm going to say Monday of next week, we'll have our online scheduling platform available. Could be sooner, but I think Monday is a safer bet. So as long as we have supply, we'll be opening up the online scheduling platform for people. So lastly, I just want to emphasize essentially what Sam was saying. This is a very difficult situation for all of us. I understand it's scary, and I understand the vaccine is the first glimmer of hope that any of us have had to a return to whatever normal might be. But it's not a light switch. We don't just flip it and we're done. I would think best, if you've read some of the articles out, best case scenario is we won't finish our vaccination process at the national level until, probably early 2022, definitely late 2021. So this is not a sprint. It's a very, very, very long marathon. I'm just grateful for our partnerships to get us through this. So that's all I have, unless we have some questions.
Any board members have any questions? I see Marita moving her finger.
I don't know how to
Raise your hand.
I want to thank Mr. Leach and Mr. Archer. They've been very responsive to the innumerable emails and feedback I've been giving them for the community. And I think the county's in good hands with the partnership that's been formed between the two of you. Thank you. My first two questions are for Mr. Archer. The priority for how people get scheduled, you said there were 5,000 on the wait list. Will it be, as you said in your earlier part of your comments, you called in 10 days ago, you go before somebody did 5 days ago? And just sort of piggybacking on that, when you discuss the online platform to schedule, who would be allowed to do that? Only those people that are told that they can schedule? And then I have a question from Mr. Leach.
Okay. For the priority, basically, we're going to be calling. We're going to sort our list by age, and we're going to be calling. And so it's important for the public to know, answer the phone if we call, because if we call and nobody answers, we're going to the next person. And I think we just have to be able to do that to be efficient. So that's basically, there's going to be kind of two levels. One is age within the 65 and up category, and the other is going to be who answers the phone when we call. We don't want to leave a message and say, give you a half hour, 5 hours to call us back, because that's a slot that we need to fill as quickly as we can. So that's kind of the process that we have. In regards to the online scheduling, it'll be open to anybody and everybody. It will not substitute. It will be a complement. So we'll maintain our call phone scheduling process. You'll still be able to call that phone number, because not everybody has access to the internet or the ability to schedule online. And so that's why it's taken so long to build, because we want to make sure, we've been very, very clear that we're not scheduling unless we have a dose, a vaccine to give you. So if we have 400 slots, 400 doses available, if someone calls in by phone and gets scheduled, the online system needs to be aware that we have one less dose, and then vice versa. So what will happen is there'll be on our website, there'll be a platform, and if there's a slot open, you click on it, you put your information in, that's your slot, and then we know that's one less vaccine dose and one less appointment slot that we have.
Mr. Archer, you said you're going to prioritize in the 65 and older by age. So if somebody calls who's 76, and they called a week ago, you'll prioritize them over somebody who's 66 who called 2 weeks ago.
That's going to be our attempt. I mean, I'll be the first to tell you it's going to be messy. We've got, there's so many factors involved. A, do you answer your phone? B, are you available on Thursday or Friday? We've had a lot of people that have turned down the appointment because they weren't available those days. So.
Okay. I mean, that's a significant piece of information that's important
Yeah.
for the public, because you're prioritizing by 75 and older or age versus 65, and
Well,
that's
no, no, we're looking at the body or the population of 65 and over. We'll sort our list by age, and we'll start calling from the top and working down. Not 75 and older, 65 and older.
okay. All right,
Yes.
thank you.
Yeah.
Which Supervisor Callaway, if I may jump in, keep in mind that the state guidance has been very fluid on that particular matter.
Yeah.
So, if it sounds like Mark Twain or Public Health made one decision 3 weeks ago that sounds different today, we're trying to stay as actively in concert with what the state guidance and expectations are. So again, we don't necessarily change that in a 24-hour window, but as weeks go on, we do want to be in compliance with what the state expects from us, so that we don't compromise vaccine allocation and those kind of things.
Okay, thank you. Okay, Mr. Leach, your turn. The CVS contract with assisted living, we know they did Avalon. Have you or any of your colleagues been able to contact them on what will happen to the rest of our assisted living within Calaveras? Thank you.
Yeah, thank you for that question, Supervisor Callaway. We have not had luck in getting responses from them. We have been in contact with the care facilities in our county, and what we've been told is that Foothill is scheduled now by CVS to get vaccinated. I'm not sure if I brought that up last week, but they are scheduled in mid-February to get vaccinated, so that's a couple weeks out now. We being public health, sorry, we are committed and have been in contact with the other facilities, which are smaller than Foothill. So the other facilities in our county, we want to make sure that if they have not had appointments through that federal contract with CVS, by the time that Foothill is getting vaccinated, we want to make sure that we're stepping up to go out to those facilities and make sure that they're not waiting any longer than they need to. That is a little bit heavier of a lift from the standpoint of, it's very efficient, for example, for Mark Twain to have their clinic right there by the hospital. Make sure that if they're, in the extreme rare case where there is an anaphylactic reaction, that they have the resources there and ready. When we start going into, like a skilled nursing home, long-term care facility, we need to make sure that we're prepared for everything that can and might happen. And so, it's good that the federal contract was done. We're balancing that with our frustration locally and the calls we've got and the frustrations we've got from our community who didn't understand that contracting process and wants to know why we didn't drop what we're doing to go to those places and work with them. And it is something that we've discussed in partnership with Mark Twain as well. And I would hope that at the February 9th, Stacy, am I getting that date right? The February 9th board meeting? Yes. That by then we will have a very concrete update, if not sooner. But we are planning behind the scenes to make sure that those residents get taken care of in that mid-February window. If not sooner, hopefully. And still waiting for clarity from state CDPH, California Department of Public Health, as well as CVS. If we get any communications from them that clarify this further, I'd be happy to put out a press release on that issue. And I know it's something that's important to our community.
Thank you both very much. Thank you, Mr. Chair.
Thank you, Ms. Callaway. Are there any other board questions? Give you a moment. I see some of you lean forward and a no for right now, so I'm going to go ahead and proceed.
Okay. Ben.
Oh, Mr. Toffanelli, good to see you.
Yes. Hi. I do have a question, and it's for Sam or Dr. Archer, either one. we talked about it earlier, that you get your first vaccination, and then about 4 weeks later, you get the second one to become immune. If somebody doesn't get their second one, is there a time frame after 4 weeks that you have to start over? Like if you wait 6 weeks, 7 weeks, because you didn't have a chance to go in or whatever, does the first one wear off and you have to start over? Does that happen at any time? And what time does it start, if it does?
So, Sam, I'll try to answer this one. If you have more info, dive in. I think the true answer is we don't know. They haven't studied the vaccine in that way. Moderna is pretty specific in their documentation that the second dose should be administered at least 28 days later, 4 weeks later. Pfizer isn't as clear on, at least or 3 weeks or more. So I honestly don't believe we have good data, and me not being a clinician, I don't want to, guess too much here, but what I've been reading in the news and in some of the journals and talking with our doctors, first dose gives you somewhere around 60% immunity. I think I've heard as low as, low 50%, as high as mid 70s. Second dose gets you up, depending on the vaccine, Moderna or Pfizer, gets you up to about 95%. I do not believe that you would start over, so to speak, for quite a while, because what I've been hearing is the antibodies, your resistance immunity lasts, they would think, at least about 1.5 to 2 years or more. But the challenge here is, we've got a year under our belt, and we just don't know. There's not enough data to really say, definitively either way. So I think that's why it's important to follow the manufacturer guidelines. Moderna 4 weeks out for dose 2, while we're so adamant about keeping those second doses, and then for Pfizer 3 weeks out for dose 2.
Yeah, it's a fair question.
And it's safe to say that, I'm sorry, Sam, go ahead.
Sorry, Supervisor Tuffanelli. I think Doug covered it very well. I just want to remind people, because it's easy for us to use that word immunity. We need to remind people that even after the second dose, that's where you would achieve 95% immunity according to the studies. So it's not a perfect immunity, and it's important that there's still so much unknown because of how new this is. So I don't want to pretend to be a medical expert in this regard, but the things that we do know is what we don't know. And what we don't know is, are we still spreading when we have the 95% immunity? So it's important, public service announcement here, as people do start to get doses and get second doses, that they're making sure to still follow the same safety precautions. There's a lot of reasons for that. And I'm sorry, this isn't exactly what you asked, Supervisor Tuffanelli, but it's important information to get out there. Frankly, I might pick something up through, we don't know how the body's responding to it. And so maybe I've gotten 2 shots, and I'm probably a good example, right? I get 2 shots, and then I go home, and I've got a wife and a part-time kid who haven't gotten shots, right? And all it takes is for me to be, in their close proximity, the droplets spread, and pretty soon, even though I didn't have any symptoms and I have the 95% immunity, it's possible that I'm passing it, right? So it's important that even as you're getting your vaccines, your shots, you don't view this as, okay, now I'm perfectly immune and I'm Superman and I can do whatever I want. That's absolutely not a good message to have out there. The other thing is, look, we're in this together, and we've got to make sure that, there's no way to track, we're not going to all walk around with a, I'm 95% immune t-shirt on. So over the next year, as this is going on, we've got to make sure that, we're a community that's coming together and understanding that we don't know who's been vaccinated and who hasn't. we don't know who's carrying COVID and who isn't. And so the same safety precautions that we've been pitching for the last, 10 months will still remain very, very critical as we move into this year. Okay, so sorry for the long public service announcement. Your question is a fair one, but I think Doug answered it very, very well. And the last thing I will say is Doug and I have been working with, his team and our team. We want to make sure that at the February 9th board meeting, sorry to make the announcement, Doug, but at February 9th meeting, we do have a couple of our local doctors, one Dr. Atwell from Mark Twain, as well as Dr. Beatty from our shop in public health. And we want to get them in here to give a little bit more of an update from the medical side, because it's been a while since we've had that. So we'll do the best we can with the kind of common knowledge stuff that we can answer, but that stuff's important too, and we want to make sure that we're communicating that as well.
Thank you for that, and thank you for that announcement. So it's going to be just as critical as getting a core of people that progress through the phone calls and making the appointments, and then a separate crew making sure that you're getting appointments for the second dose and tracking those, so nobody's overlooked and not told to come in for their second dose after 4 weeks, 5 weeks, whatever. So there's a lot of tracking that needs to be done here. So there's a lot of work just involved just before you even get it, your dose, or even your second dose, that needs to be maintained and tracked. So thank you very much for all the work, both of you and your staffs.
You're welcome. There is, and there are obviously specific medical questions that come up over time. That's why we do have a medical officer. We do run those things by them as they come up. So, sometimes people get into, I ran a slight fever after I got the first dose. Do I get the second dose? Those kind of things we staff and have processes in place for. But this isn't the format to address those things broadly, or it starts to spread, kind of misinformation. People try to apply, it's like going on WebMD and trying to diagnose yourself. It's something we've really got to be careful about. Make sure we do it individually where it should happen, in conjunction with people's individual medical providers. And, per our last announcement when I addressed this last week before, to make sure that, now's the time. Reach out to your medical providers. Make sure you get the information you need to get about getting vaccinated individually. Okay?
Thank you. Was that all, Mr. Toffanelli?
Yes, Mr. Chair, thank you.
Mr. Garamendi, thank you for waiting patiently with your hand up.
No worries. First off, thank you both for your presentation today. There's a lot of new information that we're all hearing here today. I have an absolute ton of detailed questions that I'm not going to open up at this stage in the meeting. But what I want to know is, you both expressed that you're in many ways being overwhelmed by the response and by everything that's going on. So I want to know what you need from your Board of Supervisors and to enable you to scale up to meet this challenge. So we don't just weather it in a block position, but that we actually move forward. So tell us what you need from us to make you successful and this county healthier.
You want me to go, Sam?
Sorry, Doug. Yeah, go ahead.
Okay. So thank you, Supervisor Garamendi. I appreciate the offer. Quite simply, it is vaccine supply. That's the number one thing, obviously. But I traded a lot of messages back and forth with Ms. Calloway over the weekend. If you have constituents that you feel I should be connecting with and reaching out to, I'm happy to do that. I think I don't know that we can give them the news that they want. However, if you think I can help, explain the process or answer questions for individuals, I'm happy to do so. I think communication is going to be the key. So as you always do, all of our Board of Supervisors and elected officials just sharing what we talk about. And if you have opportunities, I'll volunteer myself. I won't volunteer Sam for this, although if you want to join me, you can. If there's groups that are meeting via Zoom or otherwise, large bodies of people that you think it would be beneficial for me to address, I'm really happy to do that. It can take some time to do so, but I think it's good information, and I'd rather communicate as much as possible with the people directly impacted. So I know you have my contact info. If not, I know Sam does. And I'm truly happy to field calls or emails or get up and speak to whatever groups you think would be helpful. Aside from that, we're really okay. We have the staff that we need. We've got the supplies that we need. If you could, change the weather, that would be helpful, because when we're doing the outdoor vaccine clinic, rain and cold isn't fun, but I don't know if that's within your scope as a supervisor to change the weather. But if it is, that would help.
Sam? Same question.
Yeah, it's amazing. After you would think that Doug and I rehearsed this answer together, and I can assure you we did not. You say communication is key, and you kind of took the words out of my mouth, Doug, because I think a lot of the frustrations, frankly, on, I won't put words in your mouth, Supervisor Garamendi, but a lot of the frustrations that I've seen from board members in general and from myself are both about just the intense timing that we're going through and how difficult it is to cross-communicate that information. So it's kind of like, every 2 weeks of a board update is just nowhere near enough right now. Because look at the amount of information that has changed from, the day that I was appointed interim, December 22nd, to January 12th, by the time I got up here, and how much kind of misinformation starts floating around out there. And then we try to clear it up. And then from the 12th to the 19th, and then again from the 19th to the 26th, by the time I get up in front of the board members, you all are sometimes hearing things for the first time. And if you know government well, you know that I should never do that, right? I mean, you guys should know in advance of what I'm going to say. And the reality is these things are moving so fast. My deputy director and I are on state calls at night, in the morning. We're missing one right now, talking about vaccine distribution and allocation at the state level. And I guarantee there'll be another one tonight. And it's just constant flow of information, and the change of that information happens quicker than we can get it to you. So you asked what I needed. I'm getting a lot of the things that I need already. We have a partnership with OES. OES helped us build the data dashboard in conjunction with IT and admin. The data dashboard has been helpful in reducing some of the workload with press releases, because that information is available now, today, daily, Monday through Friday. It's updated. We got the call center going. That's been an incredible help to both Mark Twain, frankly, in taking messages, as well as our public health staff, which was fielding hundreds and hundreds and hundreds of calls a day. So those things have been helpful. But really, it's getting back to communication. And frankly, I think you guys have challenged me to communicate to you as much as I possibly can. You wanted transparency. You wanted clarity. I believe that I've raised the bar on that to an extent, and it's not enough. And it's nowhere near enough. So my challenge back would be that as much time as you guys want to give, as much as we need to have public briefings, if you want that to be in another format, we're happy to explore that and do what we can. Now, we want to make sure that that's in a way that doesn't, constantly pull us off getting the information from the other side, right, from the state and all of that. But I think it's important to be communicating as much as we can with the public, and you guys are the first layer to that a lot of times, because you're hearing from constituents who are frustrated because they don't know what the answers are. And I'm trying to cross-communicate a lot of information, and the flow, frankly, is, if we were doing this once a week, would it be enough? Probably not. But it's, how many times can we meet and get together and disseminate the information? But I know that every couple of weeks is a lifetime right now. Doug, is that fair? I mean, I'm sorry to punt here, but 2 weeks, I went back to my notes, Supervisor Garamendi, this morning for what even happened on January 12th. And as I was reading those notes, I thought, I hardly even remember this. I mean, 2 weeks is a working quarter right now for me.
Yeah, Sam, I get it. We've been doing this since March, so I understand how things change. Thank you. But, I think, and what I'm hearing from you and Doug is that you need help in communicating. And I think you hit the right tone, which is we can't help you communicate if we don't know what's going on. And that's in a granular matter. And these are things we'll get into later, but, understanding how Mark Twain is prioritizing that 65 plus is really important. Understanding and feeling, you gave me a doubtful look there, Sam, but understanding that we're coordinating our lists with Mark Twain so we know who got done. Those are the things that we need to understand so we can communicate. It seems like when you talk about what our restrictions are, and so I guess you've got what you need, but I have two questions regarding vaccine. One, what is the methodology that the state uses, or Dignity uses, both use, to distribute the vaccine? What are the limiting factors to our getting that vaccine? Is it storage? Is it sign-ups? What is it? And then sort of help me understand how we are allocating that. And more important, let's assume that the new president is able to get 100 million doses out there. Do we have what we need to rapidly scale to get that? So we could fill that football field-sized plane that Sam described earlier in a quick and efficient manner using all the resources we have in this county to help keep our people alive. So if you could answer those two very broad questions, I'd appreciate it. First one being limiting factor.
First one being what?
First one being, what is the path for us getting more vaccines? What is limiting that? Is it a state?
Yeah.
Where's the narrowing of the band for this throughput?
Gotcha. And I'm sorry, I was squinting because the communication was coming through a little foggy.
Okay.
Yeah, trying to interpret my nonverbals is fool's gold, so I apologize for that.
Well, on my screen, I've got you sitting right next to Doug, so dual panel.
Nice. My head must look massive in there, especially with all this glare. Look, the flow from the state is a incredibly frustrating thing to explain. Where we started, so here's a short answer. The answer to that in December was different than the answer is in January, and it will be different in February. So right now, what we're getting is the MCEs, such as Dignity, right, which gets the supply and then filters into Mark Twain, applies for their own allocation. But then we also share allocation with them at times if we get enough to where we know they have the sufficiency clinic going with the population we need to target. We can throw them 300 doses and they can get it done in a day, like that, right? They've got it going. So we get our allocation, they get their allocation separately. There's the CVS, Walgreens, federal allocations, and then there's the other private entities. So it's been pretty messy. The state's frustration with that is trying to get data transparency. And the state's most recent answer for that they're looking at right now, that I expect to be a change, is that they're trying to build in a third-party administrator. Now, the third-party administrator, and Doug, I'm not sure if you're up on this yet, but the third-party administrator would completely be a game changer in how we receive allocation. And unfortunately, I'm a little skeptical that that's going to immediately improve things. Because I hear third-party administrator, and I think another level of bureaucracy. Right now, we get doses, we put them into arms. Okay? We have our tiers. We know that we need to be working with the 65 plus, and parallel, we're boarding that plane with the other folks in that tier that I mentioned. And we try to do it in a structured way, and it depends on the flow. So there's a science to it because there's the tiers that are built in and who's our most risky. But then there's also the art of, okay, we scheduled 100 IHSS workers and 80 of them showed and 20 of them canceled or no-showed, and we're ready to go with these other 20 doses. What do we do with them? So that's what I mean. There's also an art to it of, great, we've got this other small pod of people that we were planning to do next week. Call them in right now if they can come, right? So that we're not wasting doses.
I guess my question is, Sam, are we limited on our side for this throughput? Is it quite, do they look at us and say we don't have capacity for storage? We don't have capacity to put them in arms? Is there anything on our side that we can remove to make this better without trying to figure out what's going on in the state's head?
No, we've gotten nowhere near capacity, Supervisor Garamendi.
So when we're setting aside, the second dose, it's not taking up storage capacity from the first dose, right?
It's not inhibiting us getting more. That's your question, right?
That's my question. So that's not inhibiting. So then, okay, I won't get into the state.
It's not. I will say, well, on the Pfizer, let me interrupt, because on the Pfizer, we did need the specific refrigerator to get to a higher level, and we've got one coming in. We had to use a system of dry ice for a while here, but even so, we haven't turned down. It's not like the state has said, hey, we have these doses for you, and we've turned them down. We haven't been anywhere near that. We haven't even gone to overflow freezer situations.
Good.
We're nowhere near it.
So do you have the resources that you need from this board in order to ramp up rapidly should things change? I mean, really rapidly.
Yes.
Actually have people on that football field getting poked.
Yeah, I mean, I'd have a hard time giving you an exact number of what would be more than we could handle, but I'm guessing it would probably be, I can see my vaccine coordinator cringing by me making up a number right now.
Don't make anything
10,
up.
I'm going to say if they sent us 7 to 10,000, it would start to get a little difficult.
Okay.
7 to 10,000. If they sent us that today without an announcement, we'd find a way to store it. Doug, you with me?
Yeah,
we'd find a way to store it, and we could get about. I know my deputy's cringing now. We could get several thousand into arms per week.
Yeah.
Several thousand. It's hard to put an exact number on it because we have more medical providers and partnerships coming on board. So as those people have gotten vaccinated and are now coming on board, like I said they would, we're ready to go. I threw down the gauntlet to the state. I know there's a lot of questions and people have trust concerns with me. No, send them. Send the vaccine.
Okay. Then so you're good. All right,
on top of it, I want to say this because, we also have, it's one thing to be efficient and to get it all out there. But we needed to start with, when we did get this first batch and we got the partnership with Mark Twain and the governor said, everybody 65 and over, and it kind of opened the floodgates to some extent, we needed to get that supply into arms. And we did. We were challenged to get and that's, Mark Twain doing a fantastic job stepping up and us partnering with them. But, as we move forward, there are other things that we also have to be considerate of, such as, are we reaching 75 and over who are difficult to get to? And those are the things that we're building right now to make sure that we're as equitable as we are efficient. So there's the initial part of, we got this, we have the first people we have to vaccinate. We've got to make sure that we're getting shots into arms so that we're not part of the narrative that we were hearing in the media a little bit about why are people not administering doses? Why are they sitting on doses? We didn't want that to be the case here. So we're efficiently targeting people in the proper tiers, but then we also need to filter out and make sure that we're getting closer to where people are and getting travel clinics going. And that is all part of a broader plan, and we will be getting into those areas within the coming month. A month from today, we will have already started that process. So those are the things that we're building now and that we're working with OES and our partners and you guys moving forward.
All right, I thank you, Sam, and I have a lot of detailed follow-up questions, but in the interest of time, I'll delay those to later. Thank you very much, Mr. Chair.
Thank you, Mr. Garamendi. Seeing no hands raised, I'm going to proceed. I would like to elaborate on a couple of things that Mr. Garamendi brought up. When he brought up what can we do to provide help to you, we have multiple more resources that I think we can utilize through the county right now. One of those is OES. Mr. Archer, you did bring up the fact that, the high volume, you don't have the staff to necessarily field all these calls that are coming in the high volume that they have right now. And you're saying you can't pick people up off the street because they don't, because of HIPAA rules, and that they need to go through background checks and everything. We have those people on hand through OES. This isn't just a partner between Mark Twain Dignity Health and Health and Human Services. We're all here to be in part of this partnership. And we have other avenues and resources to provide you more tools to help you get your job done. And I think that's our best way moving forward. And I would like to see you all reach out and utilize these resources, because we have them on hand. And the OES stood up the call center earlier this year. They've been through part of this process. Mark Twain Dignity Health, yes, you're your own entity, but we value you, and you are a contractor of Calaveras County, and we value as that. And we need to work together, consolidate all our resources to help you guys, because look, there's a lot going on. Sam could be on a call right now, right, with the state, going through whatever changes they made today. But I just want to bring that up to follow up with Mr. Garamendi, because I think there's more resources we can bring to bear to help you all facilitate that getting done. For one, I'm going to move on to a couple notes I made, because we're all getting these phone calls, and I just want to reiterate that I do value the work that you have all already done and moving forward this far. We just want to help you be successful moving forward and facilitating things more quickly. The news in San Joaquin County last week, they had a drive-through vaccination, no tracking or verification of who was getting the vaccine, and if they fell within their tier, that's open per the state guidelines. San Diego County drive-through vaccination clinic, scheduled vaccinations, people turned away multiple times because of shortages on vaccines and overbooking. These kind of fall in lines with what you brought up. It's, these are, everyone's trying to refine their process. We aren't the only county. There's some counties that are in much worse shape than, I don't want to say we're in bad shape right now, because you'd be able to facilitate getting needles and arms. But when we talk about the scaling up, I want to bring this forward, that whatever we need to provide on resources, you both provide the people that put the needles and arms. But when we have a drive-through clinic and you need traffic control, can the sheriff help out with traffic control? Can we bring in some firefighters to help do the paperwork as people are going in? That way all the people that have their hands on the needles are doing their job on that, and then we can help you through giving you more resources to be able to, streamline that process. So you can bring it up to, you said you could probably do 300 capacity a day, right now, Mr. Archer. We're working with other people to bring that up. We can bring more resources to bear so that we can probably fast track that line going through as much as possible and vetting the people properly, which is another concern. Questions and statements from constituents. You pretty much answer some of these, calling center. They called the call center, no answer back in 2 weeks now. When you're overwhelmed with, this is what constituents are saying. One way or the other, concerns, maybe a week and 5 days. But, as we move forward, if you don't bring in those people that you're talking about subcontracting, can we give you some people from OES? It's great that we would appreciate being able to answer people sooner. That would relieve a lot of the tension out in the community. That falls in line with my original thing of bringing in OES and working with you on the call, receiving the calls. Are we tracking everyone getting vaccines? Are we giving them to the people in the most critical need in the tier system first? I mean, this is a question throughout the state from anyone supervisor's constituents, We're all hearing this. Calling Calaveras Public Health, and they refer, I don't know if this is true or not, but calling Calaveras Public Health, and they refer to Mark Twain Dignity Health on the vaccines. Calling Dignity Health, and they refer to the Calaveras Public Health on the vaccines. I think they're probably calling the wrong numbers. We got to continue blasting out those numbers. There's a lot of public perception out there. I want the public perception to start moving towards us being proactive more so and not reactive, although we are reactive when the state changes the guidelines daily. But this doesn't, to break down the brass tacks, needles and arms, whatever the tier may change, if we can facilitate that process moving quickly when we actually get those vaccines in hand, then, if it scales up, our new president's made a lot of promises, trying to get up to 300 million. We state of California, it's been on the news plenty. Only half the vaccines on hand have been distributed. So, if we're going to fast track this, storage is of a concern. I'm talking to multiple supervisors in other counties, and other people working in other counties, just, bouncing ideas off of each other. And, cold storage is a factor along with population for receiving the vaccines. So if we need to fast track an item to buy more refrigerators for you or cold storage in one way or the other, I know I'm more than willing to help. I'm sure the rest of our board would agree. Whether it costs $20,000, $30,000 for a refrigerator, we could scale that up. Let's make sure we're putting them in places that are on backup generators. We don't want a fatal power outage and lose them. I'm sure the sheriff's office would be willing to help out with that if we don't have any other place I'm sure the hospital's got plenty of backup generators, but at the same time we do have other facilities and where they can be stored safely and then distributed out upon demand. These are all things I've written down. These are all things that I want you to accept help from the county. We can all work together and all be one large partner. It's not just Health and Human Services and Mark Twain Dignity Health. We're all here for support. We all need to be successful in this together. There. It was a little long-winded. I apologize for that. But I need to get it out, and we need to say this publicly, I would hope the rest of the board would support me on giving you that type of direction. Mr. Archer.
Thank you. So I would like to report, the partnership has actually already grown. The call center has been taking taking messages from Mark Twain, adding people to our wait list since last week. So we're already stretching, and accessing those resources. It really fundamentally is a supply issue at this point. If I'm hopeful, when the supply chain issue's fixed, You know, I think we, Mark Twain, have the resources to probably ramp up to about 2,000 a week. With some of the other partners coming online with the county, you know, I think we can definitely ramp up, but we've got to have the supply. You know, we talk about needles in arms. Well, we need vaccine in the needle. I think that's really the first step to it. And then just one quick comment on like the prioritization process. I want to be very clear about this. We are doing our best to sort by age, but I'm going to tell you right now, there's no way it's going to happen, you know, consistently and perfectly. We will have situations where a 68-year-old is scheduled before a 78-year-old. And it could be because they didn't answer the phone, or the phone was disconnected, or they weren't available, or whatever. This is not a linear a linear type of thing. This is spaghetti. This is spaghetti. So we're working through it.
Or the power was out and there's no phone service.
Exactly. And I think Mother Nature has more curveballs in store for us this evening and the rest of this week.
Oh, my apologies. I just muted myself. I was already unmuted. You know, we're going to be looking to take public comment here in a moment. I would, you know, so the people in the public are aware. Are there any other comments from the rest of the board members or questions? Okay, Ms. Follendorf?
My hand hides up there. I know you've been asking and you've been talking a lot about the vaccine, but you mentioned earlier about the purple tier. And so we have a group, you know, a community of businesses that what's next for them with the winter coming up, and how we're going as a community support the numbers that we need to start focusing on getting on the lower tiers. And what are we looking at? What are those statistic numbers? You're saying we're above that, which I find surprising, but what does that mean? What is that interpreting into layman term for the public to understand, and businesses, and what we need to do next?
Sure. Fair question. So what I'm doing is I'm multitasking. So if I have a weird blank stare into the screen, I apologize. I am looking at our state data as well as the table. So for example, right now, okay, to go from the purple tier to the red tier, right, the next tier, we need to have a case rate of between 4 and 7 per 100,000. Between 4 and 7 per 100,000. Right now we're in purple because our case rate is over 7, right? And by over 7, what I mean is, according to the state data, our county metrics is 63.5. So we're nowhere near, right? And then the other factor that goes into that is the positivity rate. So in other words, what percentage of people are testing positive at our testing centers. That has actually been trending down pretty well. And by the way, on the state data, because I said 63 here, it's like 105, it looks like, 105 new COVID positive cases per 100,000. That's really high when you talk about we need to get under 7. The other part is the testing positivity rate. And the testing positivity rate would also, so both metrics have to trend this way, right? So the other one, we have to be under 8% for the testing positivity rate. Ours has been coming down. Our rolling 7-day average right now is 13.6%. So just a couple days ago, I was saying, you know, we're more than twice what we need to be on the positivity rate. It looks like we might be just under 2 times as much right now. But those are the two things that we're looking at. So what we need, frankly, is we need less people to have COVID. And we need the tests to bear that out. and what we can do for that. Sorry to sound like a broken record, but we can avoid large gatherings. We can wear a mask, right? We can be respectful of the businesses by putting on a mask when we go in, keeping our distance from people, washing our hands, right? That's how we get our community fully reopened over time. But it's going to take time, and Supervisor Follendorf, hopefully those numbers brought you some clarity. Was that too fast? Do I need to cover anything else again or provide any more clarity there?
That gave me clarity. Thank you.
Okay, we'll move on to public comment. We'll give everyone a few minutes to call in. Miss County Clerk.
Okay. Chair Stopper, I'm looking at this time. I don't have any hands raised, but I will see if anybody sends a message.
Let's give them a moment.
Of course.
While we're waiting, Mr. Archer and Mr. Leach, I just want to reiterate, we thank you for all the hard work you're going through. I mean, tireless days, I'm working them too, but it's a different standard, you know, you know, it's just, you're truly valued and everything. I hope anything I didn't bring up earlier, I just want to prop up and support you in any way possible as we all work forward together through this.
Very much appreciated. No, and I mean, it's nice to know that we have the support. I think it's in some ways it's really helped improve and grow our partnership with the county. So, I mean, there are some silver linings here, but I appreciate the support, definitely.
Thank you.
Okay.
Nothing yet, Ms. Clerk?
No, Chair Stopper, I'm not receiving any messages.
Okay, with that, I'm going to ask if there's any final questions or comments by any board members. I don't see any hands up or people leaning in, so thank you, Mr. Archer. Thank you, Mr. Leach. We'll move on to general public comment.
Thanks, everyone. Stay safe.
So, Ms. Clerk, we'll let's give it about 30 seconds. Unless you have someone already with a hand raised.
I do not have any hands raised at this moment. And I am not receiving any messages at this time.
Thank you very much. With that, before we delve into the consent agenda, I would like to take a 10-minute break, and then we'll come back. Thank you. All right, so we're going to be moving on to the consent agenda. Consent agenda items are expected to be routine and non-controversial. They will be acted upon by the board at one time without discussion. Any board member, staff member, or interested party may request removal of an item from the consent agenda for later discussion. So, with me moving forward to asking the board, can anybody in the public or staff please be ready to pull any items from the consent agenda. Are there any board members that want to pull any items from the consent agenda? Okay, I'm going to go ahead and pull item number 6. Is there any staff or members of the public that would like to pull any items?
Supervisor Stopper, this is Sheriff DeBasilio. I'd like to pull item 12.
Item 12. Thank you, Mr. DeBasilio. Is there, Ms. Clerk, is there anybody out there with their hand up?
Not that I have seen, no, and no comments at this time.
Okay. With that, I'll move on and I'll take a motion on the rest of the consent.
So moved.
So move, Mr. Chair.
Okay, I've got it moved by Mr. Garamendi, and I'll take a second from Mr. Toffanelli. Roll call. Supervisor District 1.
Aye.
Supervisor District 2.
District 2, aye.
Supervisor District 3.
Yes.
Supervisors District 4.
Yes.
And I am also an aye. That passes 5-0. We'll move on to item 6 that I pulled. I just have some questions here. Mr. Alt?
Yes, Mr. Chair.
This is quite an increase to the original bid. It's moved up by $200 and some odd thousand. That's a substantial amount. This originally was put forward in 2019. What's been the holdup on it? I could go on a few other things, but I think that's enough for you to give us some summation of where we're at.
Mr. Chair, thank you for the questions. I see also that Public Works and Mr. Packinger is here as well, so he may have to assist me. We're both getting up to speed on the content of the project. But the understanding that I have is that the original estimate of $80,000 was pretty much just a walkthrough and a general quote off of a walkthrough from 2016. And so the original placeholder had been set several years ago for the $80,000. Subsequent to that, once we had it scoped more accurately with Aspen, and as Aspen prepared bid documents to complete the project, the actual specifications drove cost increases that were picked up in our final estimate by the job order contracting company that we've worked with. So I guess the summation is originally several years ago, the $80,000 was not much more than an administrative guess, and that once we had it scoped properly, the costs associated with the appropriate scoping caused a significant increase in the pricing.
Understood. Is there any other board members that have any questions on this? If not, I'll provide an opportunity to the public for any questions, or as this is a pulled item.
I do not see any public comment at this time.
Thank you. With that, I'll entertain a motion.
So move.
Thank you, Ms. Callaway.
Second.
I'll second.
Okay, Mr. Garamendi, for a second. A motion by Ms. Callaway, a second by Mr. Garamendi. Supervisor District 1.
Aye.
Supervisor District 2.
District 2, aye.
Supervisor District 3.
Yes.
Supervisor District 4.
Yes.
And I am also an aye. So that passes 5-0. Let's move on to item number 12. Mr. DeBasilio, you pulled this?
I did. Thank you, Chair Stopper. This is the contract that my staff, myself, and administration have been working on for about a year and a half, trying to get our Department of Health Services contract squared away. We thought we had it squared away. However, the state has thrown a monkey wrench in the process, and it's a small monkey wrench. They want to have us, they want to approve the contract before I bring it to you, showing that it's been approved by the state. So basically, we're still moving forward with it. It looks like it's going to be delayed about a month. It looks like we will probably bring it back to you, I'm hoping, sometime towards the end of next month. The contract would probably start at the beginning of March, and then the beginning of April, we would actually have people in beds. So the contract is still moving forward. It's just the state has a certain way of them wanting to do things. So unfortunately, this came at the last minute yesterday at about 4 o'clock, so I have to pull it at this time, but it will be back here in a short period of time. Any questions on this?
No, Ms. Edwards, do we have to motion to pull this right now because it's been agendized?
It depends on how the sheriff wants to handle it. It sounds like we don't necessarily have a date certain for which particular meeting we'll be bringing it back. So my recommendation would be that the sheriff just withdraw it at this time, and then his staff can re-agendize it in the future whenever they get the green light from the state.
Understood. Mr. Toffanelli, I see your mic's off. Do you have a question?
No.
Okay.
I don't.
My apologies. Mr. DeBasilio, just want to pull it?
Yeah, we'll go ahead and just pull it, and then we'll re-agendize it once we get squared away with the state then. Thank you.
Okay, thank you very much, sir. Okay, that sums up the consent agenda. We'll move on to the regular agenda. Item 15, Administrative Office. After a presentation, provide direction to staff regarding the redistricting process. Do you need a moment, or are you ready for the presentation?
Mr. Chair, I don't need a moment at this point in time. I'd just like to introduce the item, if that's all right.
Absolutely, sir.
So the staff report is pretty robust on this particular item. As the board is well aware, redistricting is the once-a-decade process of redrawing the political boundaries. This is obviously a very important issue, and the process requires the utmost transparency and equitable drawing of the lines for each of the districts. As is evidenced by the staff report, there's many ways to go about this for the board. And so this is just the first view that we wanted to provide for the board to understand that there would be a cross-functional team assigned for redistricting to carry out the board's directives as we talk through this, not only in this discussion, but in future presentations as well. Our first effort is to explain to the board any legal changes that are important to the board. Obviously, Ms. Edwards is here to be able to discuss that. Also talk about any effect that there may be for the county clerk's office and the timelines for which we would be moving forward on the redistricting based on direction from the board, not only in this conversation, but any following that the board asks for in the future. With that, Ms. Edwards, is there anything that you'd like to cover particularly before we get into discussion about legal changes or mandates?
No, not in particular. As you will see if you reviewed the staff report, broad strokes, the process is substantially similar to the last go-round, at which point some of you may have been on the board. That said, there are some changes that have been made since 10 years ago that kind of just change the process in, I would say, not in substantial ways, but do affect what criteria are used, and frankly just kind of add on to the public outreach process in as much as additional public meetings are required beyond what was required 10 years ago. And I think that's kind of all I have at this point, although, of course, if the board has any questions, the CAO and Ms. Turner and I are here to hopefully answer them. One thing I should point out, as you probably all know, this has to be based on the official census data. We are informed that that is going to be delayed, and that we should not expect to see that until May or June, which is later than in prior go-rounds. The deadlines for then doing the redistricting have not been moved accordingly, so we are going to be working on somewhat of a shorter time frame in terms of getting this all done and using the data once we've received it.
Do we have any potential, once we receive the data, is there any potential date put forward for receiving the data?
At this point, and Ms. Turner, obviously correct me if you've heard something more updated. I had heard May or June. Nothing more specific than that.
Mr. Toffanelli.
Either Rebecca or Sarah, last time we did this, the state mandated that we use the census blocks in order to cut the lines. Is that still something they're requiring, that we can't just draw the lines, we have to go by their blocks in order to do it? And then the other question is, the public outreach, they're requiring us to have public hearings, and where we're at right now in COVID, it's going to be very difficult to have any public meetings other than a Zoom type meeting. I think that's something we probably needed to look at or discuss.
Yes, so I can just quickly speak to that, and then I'll let Ms. Turner jump in, since she was very involved in the process 10 years ago, and I was not. So yes, we do still need to have public hearings and or workshops. I have not heard. Obviously we're going to be playing by ear to some extent what current COVID restrictions or best practices are as we move through the summer. But yes, if we're still looking at where we are right now, these are going to be virtual public meetings of some type. And with respect to the, sorry, go ahead. I'm sorry, I wasn't sure if I interrupted. And then, yes, the changes probably most significant to the elections code are with respect to the criteria that we use. Those criteria that are laid out in the staff report are mandatory and must be used in that order. And then I'll let Rebecca speak to how that differs or doesn't from the county's process 10 years ago.
So the law itself is more specific as to what processes we have to follow. We definitely do have to follow the census blocks. That was actually a requirement prior to 10 years ago, but our county was unable to use anything besides TRA due to, I'm assuming, lack of a GIS system, which we now have and did 10 years ago. Fortunately, 10 years ago, even though these requirements weren't set in place, it was highly recommended that you follow this, what the law is currently laid out as requirements this time. So we did essentially follow the same requirements the last time we did the census. So it's not a significant change for us per se. It's just now, instead of doing these things as niceties, we have to do them because it's required.
Yeah, well, the reason I bring that up is when we did this last time and we followed census blocks, it kind of cut neighborhoods in half. And you go down Vista del Lago, I'm looking at, and you've got Lock and Ten on both sides of that road, but it was part of the census block, so we ended up with people complaining that, you know, they're out not in either district that they preferred to be in because of the census blocks. So
I don't disagree
and I know
with
the previous time we didn't and I know the previous time we didn't use census blocks. We used like fence lines and things like that because apparently we didn't have the GPS at that time. But it's going to be very difficult trying to find a medium here to where everybody's happy trying to follow those census blocks, because a lot of times they don't make sense at all what they're cut into blocks. So, and I think the rest of the board, Marita remembers and Marita knows, but the rest of the board wasn't here, and they'll soon see when those maps start coming to us, when it's in May or whenever we're going to finish doing this thing, they'll see how tricky it is to try and cut these things into and make everybody happy into districts. So
I completely agree with that. I do want to say, because of some of the struggles we saw the last time, Doug and I have been working with the census, really pushing them, because some of our lines don't quite match up, like the school district lines were off. So we've been battling for almost 10 years to try to get the census block lines to match up a little bit more with our community of interest. The problem is some of the major changes we wanted to make, which would have lined townships together in their own strategic boundaries, the census rejected and said no, because of historical data purposes and data collection, they needed to keep those lines the same. So some of the boundaries we've been informed will be adjusted. We haven't been able to see a definitive map of what they'll look like yet, so we're still waiting till the May-June date to see what that does look like. Prior, we used tax rate areas, which already line up all the special districts in the communities into where you're paying your taxes. That's where we were lines we were following, which is ideal because that keeps community of interest intact. So oddly enough, one of the requirements that we have to follow is keeping community of interest intact, but then the census block is the top priority, and it's the one that cuts those in two. So it is a struggle, and I think when we're looking at the mapping, we're going to take that into consideration. I think as the election official as well, I was, in the last 10 years, one of the main ones who got the major complaints where people were upset. So I have a fairly good idea of what people are cut out of their boundaries. And that was some of the line adjustment that I really pushed being made this last. But again, I can't control what the census blocks look like. I will participate in whatever mapping changes to ensure that some of those boundaries get lined out the way they really ought to be. Like if they're cut off by a ridge, for instance, District 2 and District 4, have a mountain line going through them, but some people got put on what I would consider the District 4 side because they have no way of traveling to District 2. But there were just some definite issues in there, and we'll look at it and do the best we can.
thank you.
Any other board comments or questions? This is Ms. Turner, this is only the first meeting and mostly informational as we move forward. So there's going to be multiple, yes, Marita, I'll get right to you. I see your hand now. we'll be through a series of multiple meetings and public outreach throughout this entire process. So this is just the first step of many.
It is. I did want to bring one other thing to the board's attention. As mentioned, as you said, this is just an informational item. We will be back in front of you as the process proceeds. But I did want to highlight the fact that the board has the option of forming a committee who could be either a purely advisory committee or a committee that even handles the entire process and adopts the map itself, should the board choose to delegate that authority. And so that last point is different. Prior to this go-round, the board could have an advisory committee, but not a committee to handle the whole process up to and including adoption of the maps. So we don't necessarily need to tell us today how you're interested in potentially or not forming a committee, but that is something to think about because we'll obviously want to get started on that sooner rather than later, bringing an item to you to form such a committee if that's the will of the board.
Thank you. Ms. Callaway?
That's what I wanted to address. I would like to see an advisory committee. I think the final decision needs to rest with the board, but there's all kinds of permutations that we'll be going through in developing the map, and an advisory committee can take some of that, excuse me, that time from the board, and there's all technical details, as was discussed earlier with Mr. Tuffanelli and Ms. Turner. So I would like to see us support an advisory district commission to handle all of the preliminary work and maybe make a recommendation or give alternates like map 1, 2, 3 and let the board work it through. It is extremely a time-consuming process, but I think the board has to take ownership of the redistricting. So I would let the final decision to rest with the board. And I bring it up now, so if there's board support, we could start thinking of how we'd want to assign commission members who would be on it, so forth. Thank you, Mr. Chair.
Thank you, Ms. Callaway. Any other board comments? Questions? I'm going to give time for public comment. Let's, Ms. Clerk, let's give the public opportunity to comment.
At this time, there does not seem to be any public comment.
Okay, well, we'll go ahead and leave that open for a minute or so. Is there any more discussion to be had by the board?
Mr. Chair,
Yes, sir.
just want to make clear, we're just getting information right now. We're not getting any direction, Rita's suggestion or any other right now, correct?
Right now, this is informational item only. So it's built for questions and, just general talk on our options on how we want to move forward.
It is. That said, if a majority of the board concurred with Supervisor Callaway, we could certainly bring back, it would be for a future agenda item for you to consider the formation of an advisory committee. If you want to give that direction at this time, that's fine. Alternatively, that can come at a future update.
Well, I'll hear from my fellow board members on Ms. Callaway's comments and see if we have appetite for that. Well, there isn't much comment towards those ends right now, so I think
Mr.
Gary's-
Tominelli has
Thanks,
his.
Supervisor
Oh,
Tominelli.
I apologize. I missed your hand, Gary. Go ahead.
Okay, thank you, Chair Stopper. I'm not in favor of that. We didn't do that the last time or the time before. I think we can work through this as a board. I think it'd be more beneficial to do that. I think it'll be more open for the public to see as we go forward and have these meetings as a board. We're out there, they're aware of what's going on versus a commission that may not be a Brown Act commission. So I think it's very, very important public-wise that these are all open meetings and it's through the Board of Supervisors who has the ultimate authority to make the lines and divide the county into those divisions. So I'm not in favor of a commission of any type.
Heard Mr. Tofinelli. Mr. Garamendi.
I agree with Gary.
Ms. Fullendorf.
I'll go with the majority this of the consensus.
Okay. Well, it seems like we have our answer for now on the committee. Right now, it looks like a majority of the board has appetite to move forward as the board through the process, and as Mr. Tofinelli has said, publicly with transparency.
I do have one question.
Yes, ma'am.
So without having a ad hoc or any type of committee, how, I guess this is staff, how do we give feedback to staff on things, not necessarily to the map, but outreach?
So I think
How did that come into play? And I only ask that to keep those items more streamlined.
I will speak to what the law, what the elections code requires of us, which that we are mandated to perform outreach to communities and individuals who we know to be interested in county government, anyone who is asked to be notified, etc. So there is kind of a checklist of groups, individuals that we do need to perform outreach to. I'll let Rebecca speak to how that was handled 10 years ago, if she doesn't mind.
So as far as the outreach portion, I think I had a very small participation there. But as far as I'm aware, the supervisors held public meetings in each of their districts, so many of them, and then GIS came along with their maps. Gary's nodding his head, so I think I'm on the right direction. I think as far as public outreach, like a formal public outreach, that wasn't as robust as far as I'm aware. I would think this time we would be looking at like actually reaching out to these groups that are considered important to the process. Again, I don't want to step on any toes on how this would work, but I do want to throw out there we had a similar process when we did introducing vote centers to the public. So some of those contacts we've compiled when we did the vote center outreach that I can pass on or do something with as well.
And that makes sense. As you noted, we're required to have a minimum of 4 public hearings, right? And throughout the process, and the timing depends on, pre and post draft maps. But so there would certainly be nothing stopping us from having 5 and having 1 in each district. So that's certainly one way of approaching that.
Supervisor Chair Stopper.
Yes, Mr. Tofinelli.
And to that, Sarah, what you're saying, Ben and I's districts are pretty close to the basis of our district. So if we had 4, I'm sure he wouldn't be opposed if we had one general meeting that brings in both of our districts, because there is a close line on the population in certain areas of those blocks that I got a lot of comments from previously when we did this, that it would be generally better to have and more open to have everybody from both those districts that has to do with at one public meeting instead of two separate ones. So we'd have everybody there involved.
That makes sense. It certainly doesn't, the meetings or public hearings or workshops certainly don't have to be organized by district. That's one way of doing them. There are others.
Ms. Foldorf?
So piggybacking off of Gary, I guess that's a perfect example of what I mean by the dialogue with the board, all five of us, versus what Marita has brought up of a committee of more the logistic details in the background of these items. How are we going to approach this? Are we going to continuously come back and have this dialogue like this, or is logistically to streamline for certain parts of this process, would it be better to take Marita's consideration to deal with that? And I don't mean that overall, just there's so many moving parts. Is this the best use of our time? And you don't have to have an answer, it's just food for thought right now, because I don't know if this is the best process to talk about these type of details logistically of what we're each going to do, when we could really work with that more closer through a committee to ensure that we're each successful in ensuring we're reaching out to our constituents. But that's just thought that just come right now off of what Marita has said on those particular items.
Well, her Supervisor Foldendorf, I'd like to follow up on that. We work through these meetings, but the lion's share of the work is falls on staff moving forward. Bringing all the data, being able to present it to us, and everything else. Right now, with COVID and everything else going on, I mean, we have a large list of priorities that we just put forward. Mr. Alt, would it be beneficial for us to bring in a consultant to help with the work prior to it coming to the board? To possibly give some more room for staff to be able to work on other priorities?
Mr. Chair, that is one of the options that is contemplated in the staff report. I can honestly say I don't know at this point in the game if we could secure a consultant that the board would be happy with. But that said, we haven't also looked at that. And one of the things that, while we've got very, very competent staff, certainly in council and the clerk's office, won't necessarily speak for myself, but they come with off-the-shelf processes to help with the communication with the public and templated processes with the transparency pieces of it that might be helpful for us to utilize without recreating the wheel. Not that we haven't done this before, but it has been 10 years, and methods of communication were a lot different 10 years ago. So there is some benefit to utilizing consultants, and that's certainly the prerogative of the board, and if that was the recommendation, then I would examine those.
Okay. Mr. Garamendi.
Yeah, Mr. Chair, I'd like to see what our board, what our staff can do. I agree with Al that there's some advantages for communication and getting that outreach, but our GIS department is awesome. They're winning awards. The work that they were able to provide to us for the general plan, for cannabis, I mean, I can't imagine there's someone who can do it better than our own folks. If we task this as a priority, I mean, I've never met that group has never. We've never presented a challenge to them that they haven't met.
No, they're good people. We're good. We're lucky to have them. Mr. Tom?
I agree with Jack.
Okay.
Yeah, I agree with Jack. They were very involved last time, 10 years ago, and that's been 10 years since then, in bringing us all the information that we needed, along with Rebecca's office, the clerk's office. So I completely agree with Jack.
Okay. Thank you, Mr. Toffenelli. Ms. Callaway, Ms. Fullendorf, any comments to that? No? Okay. So we'll move on. Is there any other comments or questions as we move forward? Is there anything that more in direction, Mr. Alt, Ms. Edwards, Ms. Turner, that you would request from us as we proceed?
Mr. Chair, I think with the information, at least from my perspective, certainly my colleagues might share something different, but I think right now we have enough information so that we can get back together with our cross-functional team and lay out some options to bring back for the board. As you mentioned earlier, this is obviously going to be something that the board needs to see several times. We won't leave from here and develop a plan without bringing it back to the board for action, or at least information as next steps.
Excellent. Thank you, Mr. Alt. With that, I'm going to go ahead and move on from this item. We did public comment earlier, I believe. So let's move on to regular agenda item 16, information technology. Excuse me. Approve the attached quote for Microsoft Enterprise Agreement with CWD-G in the amount of $447,313.08 for a 3-year period from January 1st, 2021 through December 31st, 2023. Authorized payment by county administrative officer or designee for the first year of the agreement for $149,104.36. Authorize same amount payments that will occur in fiscal years 2021, 2022, and 2022 and 2023, as well as annual license true-up costs provided there are adequate appropriations in the information technology budget. With that, we'll open the item. Mr. Alt? Yes.
Mr. Chair.
Stand on here?
Yes, I'm on. So, good morning, Mr. Chair, members of the board, members of the public. I'm Stan Moore, representing information technology for the county, and want to bring this forward to the board. This is something that we do typically every 3 years, or at least this is the third time in the amount of time that I've been with the county that we have brought forward a 3-year enterprise agreement with Microsoft. And so the recommendation is that we approve this 3-year agreement. This provides something that's referred to as a service agreement for licenses that we have already purchased, for typically desktop licenses and server licenses that are Microsoft licenses. So whether that's Office or whether that's Exchange, and server licenses as well. It gives us the right to use these licenses, gives us the ability to upgrade the licenses when Microsoft makes changes, makes the administration of those licenses something that is a little bit more streamlined than it would, a lot more streamlined than it would be if we did not have the enterprise agreement in place. In order to get the best pricing on this, we work with a Riverside County developed agreement that is competitively bid, and we piggyback on top of that agreement. That ensures that we get the most competitive prices that any of the counties in California are eligible for. That is very helpful. Microsoft does not give a lot of attention to customers that are generating less than $1 million a year in revenue. So this is a way that we can bring the best deal forward to the county on these licenses. So the amount, the annual amount is, as listed here, $149,000. That will be the same for a 3-year period. During that 3 years, there will be times where we may bring in additional licenses. We go through an annual true-up process where we either do a self-audit or Microsoft has the ability, if they so choose, to pay for an external company to come in and do an audit. We take a look at the licenses that are used, and then we will purchase those licenses at the end of each of the 3 years. So what we're requesting is the fixed price that we've listed here, that we will pay for that $149,000 a year. This year we have $160,000 in the general fund budget, so we're good for this year. We will then turn around and budget that $149,000 for each of the next 2 years. We will also budget a smaller amount for any potential additional licenses that are purchased, that are brought in throughout the year. So that is the proposal. This has worked out quite well for us. It is a very common way of doing business with Microsoft that many other counties do as well, and we get that advantage pricing, if you will, through that Riverside County agreement. So if there are questions, I will be happy to address them at this time.
Any questions, board members? Okay, I don't see anything immediate. Ms. County Clerk, do we have any
Mrs.
public
Toffanelli.
comments?
Supervisor Toffanelli would like to.
Oh, your hand's up now, okay, sorry. Mr. Toffanelli.
Yes, Stan, is there any revenue associated with this at all? Is it produce any revenue for IT?
No, when we have additional licenses that we roll out during the year, if a department adds another PC, for example, that would be considered a growth PC, then we charge that department, whether they're a general fund or a non-general fund department, to reimburse IT for what the cost of that will be. That will be paid at true-up time, but there is no other revenue.
Okay.
I'm not seeing any other hands up at this time, so is there any public comment?
No public comment at this time.
Okay, board, if there's no other comments to this, I'll entertain a motion.
I move that we approve the attached quote and payments for the Microsoft Enterprise Agreement.
Thank you, Ms. Callaway.
Well, second.
Mr. Toffanelli for a second. District 1.
Aye.
District 2.
District 2, aye.
District 3.
Yes.
District 4.
Yes.
And I, 5, and I. Passes 5-0. We'll move on to item number 17. Thank you, Stan, very much for your time. We appreciate it.
Thank you, board.
Item number 17. Conduct a public hearing and adopt a resolution denying the appeal filed by Jerry Jones and upholding the Planning Commission's action to deny zoning amendment 2020-007. I'm going to open the appeal hearing at this time. And I would like to give planning staff the opportunity to do their presentation. Now, are we ready? I believe it's Madeline with you, Mr. Moyer, today.
Yes, that's correct. Good morning, Mr. Chair, members of the board. Just like to turn this directly over to Madeline to make a presentation, and then we'll be prepared to respond to any questions you may have.
Good morning.
Morning.
Let me just share my screen here. Okay, everybody see that? You can hear me and you can see my presentation? Perfect. Okay. So, good morning, Madeline Flandreau, Planner 2, and today I am presenting an appeal of the Planning Commission's denial of Zoning Amendment 2020-007 for Jerry Jones. During a public hearing with the Planning Commission on December 10th, 2020, Planning staff presented Zoning Amendment 2020-007 for Jerry Jones to the Commission, and during the hearing, a motion was made to approve the zoning amendment, but the motion did not receive a second, which effectively denied the project. So on December 22nd, 2020, the Planning Department received a timely appeal from Mr. Jones requesting that the board overturn the Planning Commission's denial of the zoning amendment due to the fact that the adjacent parcels to the north were recently rezoned in August 2020 in a manner similar to what he is requesting. So the original application was requesting a change to change the zoning of a 20-acre parcel in Mountain Ranch from rural residential with a 20-acre minimum parcel size to residential agriculture with a 20-acre minimum. The purpose of the rezone was for the applicant to relocate a cannabis cultivation site by transferring an eligible permit from another parcel under the regulatory ordinance, chapter 1795, as the RR zone is not included as an allowed zoning classification under the ordinance. The subject parcel, APN 021-021-014, is located here at 9,000 Live Oak Lane in Mountain Ranch. And the zoning amendment application originally included the adjacent parcel to the south, which is 021-021-013, but the owners of that parcel withdrew from the application. This is the county's aerial imagery from 2020. The parcel takes access off of Live Oak Lane and is developed with a single-family residence and accessory structures. This is one of the maps of the Oak Ridge subdivision. The subject parcel is lot number 17 of the Oak Ridge subdivision, which is the parcel in the upper left. The parcels within the subdivision range in size from 20 to 80 acres, many of which contain single-family residences. The entire subdivision was originally zoned RR, however, the adjacent parcels to the north, which are not shown on this map, were rezoned in August 2020 from RR to RA in order to reactivate the cultivation sites that are located on those parcels. So this figure shows the general plan land use designation of the subject parcel, which is working lands, and it also gives you an idea of the extent of the subdivision, as all of the parcels within it are shown here in lime green, they're all working lands. The working lands designation identifies lands which are suitable for agricultural and forestry practices on parcels with a density of 20 to 40 acres per lot, and includes lands with a combination of residential and home-based businesses. The general plan identifies these lands to allow the continuation of small-scale resource production and other rural home-based business operations that are compatible with the rural residential development. The requested RA zone is consistent with the land use designation. This figure shows the zoning classifications of the area. I have the subject parcel highlighted here in yellow. The rural residential classification is shown here in light blue. Unclassified, the interim zone, is here in peach, and residential agriculture is here in green. And as I stated previously, the two adjacent parcels to the north, which are also part of the subdivision, were rezoned to RA in order to reactivate the previous cultivation sites located on those parcels. And the county is also in the process of reviewing all of the unclassified zone parcels in order to rezone them to a classification that's consistent with the general plan. And based on the land use designation and the parcel size, the surrounding U-zone parcels will likely be rezoned to a mix of A1, general agriculture, residential agriculture, and rural residential. So I'm bringing back the aerial image so I can discuss the site a little bit more. The encroachment and the structures are shown here in the northern portion of the parcel where the topography is more level. The nearest residence, which you can see is close to that blue line stream just east, is approximately 300 feet to the east. Land uses surrounding the subject parcel, as I stated before, includes really a mix of residential and personal ranches on parcels ranging in size from 10 to 80 acres. There were many comments received to the routing of the zoning amendment application. All of the comments received were from landowners within the Oak Ridge subdivision. There was an error in the staff report from the December 10th Planning Commission hearing with regards to the number of comments received to the zoning amendment application, and there were also additional comments that were received after the staff report was written. So I just wanted to clarify here with an updated figure which depicts the locations of the commenters' residences. So 7 comments were received in total, 2 of which were in approval, those are shown here in green, and 5 were in opposition, which are shown here in pink. And the comments received in opposition primarily expressed concerns regarding the proposed cannabis cultivation. In addition, there were 18 comments submitted regarding this appeal. Many were received from the appellant's friends and acquaintances from the community, which described Mr. Jones as long being an active member of the community. However, 3 of these comments were received from residents within the Oak Ridge subdivision, all 3 of which were opposed to granting this appeal. And those 3 had previously submitted comments in opposition to the zoning amendment. An initial study and negative declaration was prepared for the zoning amendment and was circulated for 30 days per SEQA from September 23rd, 2020 to October 23rd, 2020. The Planning Department did receive 2 letters in response to the 30-day circulation period, but both were just standard state agency responses with no comments to the specific project. The initial study and negative declaration, which was prepared and circulated for the project, focused on the non-cannabis cultivation related impacts associated with the proposed zoning amendment from RR to RA, and found no potentially significant impacts. Staff was relying on the Program Environmental Impact Report and Addendum, which was prepared for the Regulatory Ordinance Chapter 1795 for the proposed future cannabis use on the subject parcel, as the zoning amendment application is considered a later activity as described in section 15168 of the CEQA guidelines. As the cannabis ordinance anticipated rezones, the initial study appropriately relied on the analysis in the EIR and the addendum for the cannabis ordinance for consideration of impacts associated with cannabis cultivation that would be permitted as a result of this zoning amendment. So during the Planning Commission hearing on December 10th, Mr. Jones discussed his proposal and his desire to have his son, who's the permittee of the eligible permit, to have him reside on the parcel and manage a very small cultivation site to be situated somewhere in the northern portion of the parcel, close to the structures where the topography is more level. During the public comment period, the adjacent neighbor to the east, Lavon Price, spoke, expressing her concerns regarding the cannabis cultivation, the proposed cannabis cultivation, and how it might affect her quality of life, given the proximity of her parcel and her residence to Mr. Jones's property. She had previously written a letter to the Planning Commission opposing the proposed zoning amendment. And during the hearing, several of the commissioners expressed concerns with regards to the comments received in opposition to the project. At the conclusion of the hearing, a motion was made by Commissioner Laddish to approve the zoning amendment. However, it failed for lack of a second. Since there was no follow-up motion, the project was effectively denied due to lack of approval by the Planning Commission. And although no follow-up motion was made to deny the request, one commissioner expressed her reasons for not supporting the motion to approve, which included concerns about balancing the needs of potential cultivators and the effects on adjacent neighbors. Some of the uses allowed in the RA zone, should they be permitted on this particular parcel, are arguably incompatible with the single-family residential use of the rural residential zoned property immediately adjacent to the site to the east, such as more commercial scale agricultural activity, agritourism, and of course cannabis cultivation. So to conclude, the appeal from Mr. Jones requests that the board overturn the Planning Commission's denial of the zoning amendment due to the fact that the adjacent parcels to the north were recently rezoned in a manner similar to what he is requesting. Although there was this prior approval, the majority of the planning commissioners voted to deny the zoning amendment after reviewing multiple letters of concern from neighbors within the subdivision regarding odors and quality of life issues that neighbors were concerned might result from allowing the proposed use. And after engaging in further discussion of the location of the subject parcel vis-a-vis the location of the neighboring residences. So to move forward, the board may deny the appeal, upholding the denial of the zoning amendment by the Planning Commission, or it may grant the appeal. Granting the appeal would then require that the board adopt the negative declaration and approve the zoning amendment, which would change the zoning of the subject parcel, APN 021-021-014, from RR to RA. And there is a draft ordinance supporting this action, which I provided in attachment 3. And that concludes my presentation, and I understand that Mr. Jones is here, and if there are any questions for him, don't hesitate to ask.
Thank you, Ms. Flandre. I want to give the board an opportunity to question the planning department on any of the information that's presented so far, prior to letting Mr. Jones or representation speak. Mr. Toffanelli.
Yes, I do have one question. The two lots that are to the north, looking at the map, those two lots that were changed to RA, they look to be substantially larger in acreage. Do you know the acreage of each one of those lots?
The parcel that is directly to the north is a 53-acre lot. The one to the west of that, I believe, is 18 acres.
18 acres?
I'm sorry, that's not right. That 18 is the one adjacent to that. It is 20 acres.
Yeah. Okay, thank you.
Thank you, Mr. Toffanelli. Any other board members' questions for now? Okay, with that, we'll move on to the Jones or representation.
Let's see. Well, I'm sorry, not all callers have their names listed, so I'm going to unmute a couple of callers. Mr. Jones, are you there?
Hello?
Mr. Jones?
No, actually, this is Tom Infacino, and I'm scheduled to speak on the next item.
Oh,
that's okay.
Thank you, sir. Yes, we're looking for Mr. Jones right now. We will get to you. Mr. Jones, if you're present, if you could please unmute yourself. So I would like to say that the two callers that I have unmuted them on my end. So it is on the caller to unmute themselves to speak at this moment.
While we're waiting, I have a couple questions for Ms. Wendo. Are the two ones that were rezoned to RA just to the north, are they in the Oak Ridge subdivision?
Yes.
They are. And Mr. Jones had said he's looking at having a small farm, whatever. Did he define what that is and what small means?
You know, he discussed during the hearing, there were several questions from the commissioners, and I'm sorry that he's not here, because as part of the rezone, that's not really something that we're looking at in terms of what he's planning on applying for with the Division of Cannabis Control. But he did discuss during the hearing, I believe it was small, like 2,000 square feet, a very, very small grow that he was discussing.
Okay, thank you.
Board, I would like to let you know, Mr. Jones is emailing me. He's having difficulty getting through. The Zoom is not allowing him to speak at this moment.
Could we possibly let him know that he can call in? He doesn't necessarily need to get on through the internet.
No, I think that's what he's trying to do right now. It's asking him to press *6, and it's not letting him go through.
Okay, I think the appellant should have an opportunity if there's a glitch. Can we take let's take a 5-minute break, give them the opportunity to get hooked up properly. Let's do what we can so that they can have their say.
Okay.
I think that's only fair. So let's take a 5-minute break.
Thank you.
Mr. Garamendi?
Sorry about that. I turned on my camera.
It's Mr. Toffanelli?
Yes, I'm here. My computer has froze up, so I'm trying to go to a different computer right now, but I'm here.
Okay, I see you on the phone there, Mr. Toffanelli. Thank you. It looks like we're coming up with an innovative solution to bring in Mr. Jones, or Mr. Jones, correct?
Mr. Jones.
For his comment. And then we'll keep him on speakerphone, and the board can ask him any questions after he's made his comment in his presentation.
Mr. Jones is on speaker right now.
Good morning.
Go ahead, Mr. Jones.
Okay. Good morning to the board members, and thank you for the opportunity to reconsider my appeal due to the fact that the two neighbors have rezoned to the RA, and by living by the ordinance guidelines that were outlined, my son's permit is not available to be used on his 5-acre parcel, and by relocating the permit and being able to do it on my 20-acre parcel was the intent. Some of the concerns of the neighbors was the possible odors, and I've looked into a commercial carbon filtering situation for a system indoors. So if I converted the outdoor to an indoor and using the same amount of square footage would be the optimum thing to resolve any of those issues with the odor. And as far as the steel that was out in the front of the property, it is being removed. That was due to a contractor said that I didn't need a permit if it was an open-sided two sides open to the air for a hay storage barn. It has been removed, and it will be taken completely off the property. As far as the concern about not living on or in the house at this time, my wife had to retire due to an arthritic condition. She used to work for the Calaveras County School District, and Mr. Campbell has attested to, I think, sent in a letter letting her know what was going on there. I had to make the house, convert it to a wheelchair accessible for her and for her safety. I had to remove the carpets, put down hardwood floors, and redo the kitchen counters, had to redo the bath and shower and the toilet. The flooring had to be redone because of tripping and or hard to get around on her wheelchair. We've been living with my son in a single-story house until the work is done. Part of the other concern was a comment was made by a neighbor as far as the outdoor situation for runoff and or contamination to water or soil. I've also looked into the indoor, self-contained, there's nothing to escape into the environment as far as water and or odors with the filtering systems and the commercial carbon air filtration system. Basically, everything would be contained in a building that's on the property, so there would be no odors and no visual sight from anybody. On a personal note, the reason we got into this whole thing was I'm dealing with a cancer treatment with radiation surgeries, and the topical cream that I use helped with the recovery of that. The arthritis that my wife and I both have, and she had to retire because of the arthritis condition that she has is so severe. So the permit would have to be converted to an indoor and or something that would allow the neighbors not to have any concern. And as you can see by the map, we are the furthest to the west off of Sheep Ranch, so the road concern as far as traffic would be mitigated. There is another access road on the property that I could use if I had to. And as far as like I've said, the water and or any odors would be contained within. So based upon that, I would greatly appreciate your consideration for approving the permit to rezone the RA, and I'll go from there.
Any board member comments or questions to Mr. Jones? see none at this time. I have one. You keep bringing up the permit that you're requesting, which is, not required for record, but you put it on the public record for this rezone. You say a small amount for your medical needs. Can you define what that small amount is?
Well, it was 24 plants, what we were going to permit for, and whatever the board sees fit to do the indoor would be fine with us. As far as going to a dispensary, they are looking for tinctures and creams with the CBD in it, so that's where the dispensaries would come involved, and we'd go through the permitting process and the state process as well.
Thank you. That's the only question I have. If there's no other questions by any other board members, we'll move on. Is there anything in summation, Mr. Jones, that you would like to bring up?
At this point, that's all I have.
Okay. Planning staff, is there anything you would like to rebut or bring up throughout?
Sorry to interrupt.
Yes, Ms. Edwards.
Sorry to interrupt, Chair, but we do need to have members of the public an opportunity to make presentations.
Okay. I was waiting a little too long for that. I should have brought that up in this 7-step process that you've put forward to me, Ms. Edwards. Thank you for clarifying. Let's give an opportunity for public comment.
Yes, we do have public comment, Chair Stopper.
Thank you.
Ms. Price? Ms. Price, are you there?
Yes, I am. Are you there?
Yes, thank you.
Hello?
Yes, can you hear us?
I can hear you. Can you hear me?
Yes, we
Yes,
can.
we can.
Thank you, Lord. How are you all today?
Very well, thank you.
Can you still hear me?
Yes, we can hear you.
Good. My name is Levon Price. Okay, my name is Levon Price. I live right next door to Mr. Jones, and I hope that you all got a chance to listen to his little speech when we were at the Planning Commission's meeting. He did on there say that he had been growing pot, and he was growing 24 plants illegally. He admitted it. Not my words. He said it. When it came time for the making of it, he said that he ends up with 5 gallons or 1 gallon of oil. Where is he taking it to get it processed? Is he processing it there? And is that possible that it could blow up or start a fire? This is still being done illegally. He also said that the house has been vacant for 4 years. He claimed he was living there part of that time. No one saw him, and this is a neighborhood watch area, so we are aware of all strangers and anything that comes and goes. Plus, we are all very, very disgusted having all the smell. We could smell that Jerry Jones was growing pot. We just never figured it out. It was him. We just assumed it was somebody else, and the smell was coming. Now, this was before this 2016 fire, the Butte fire. So he's been doing it before even the Butte fire. Where does it stop? Now, if you give him his permit and he decides to sell his property, what happens then? Can somebody else come in and buy and use the permit to build the amount that the permit says, 2,200 or whatever? Or do they have to stay with 24 plants? And as far as him saying he has buildings up there, he's got 2 warehouses that we never heard or mentioned in his first planning board whatever he did, the paperwork. There was no paperwork showing Jerry Jones's property, if he had wells, septic tanks, extra buildings. It didn't show any of that. And I happen to know he's got all that, and if you look at your pictures from helicopters, you will see the same thing. Now, I don't care what anybody else says. I don't like the smell of pot. I don't want to grow old with it. I happen to come up here to have fresh air, nice county, nice country, friendly people. So please, please, take into consideration that I've been up here just as long, if not longer, than Mr. Jones. I pay my taxes. I had to build my house and rebuild it. We put up fences. We've done everything just like everybody else. So why do we want to have somebody come in with a commercial grow and wreck our peace and our quiet? Thank you very much for listening to me.
Thank you, Ms. Price. Is there any other comments ready from the public?
There is no other public comments. I have Mr. Jones on the line still in the event you need to ask him any other questions.
I think we'll afford him the opportunity for any rebuttal of any comments made by the public.
Oops. Oh. I apologize. We lost each other. I'm calling him back right now. Okay, I'm putting you back on speaker. Here we go. There you go, Mr. Jones.
Hi, to the board members again. Yes, I've been here for 40 years. Yes, I've raised my children there. Yes, we have a septic system, a well. Yes, I do have 2 buildings. Yes, I'm going to have to redo the permit to go into indoor with an air filtration system and a water filtration system to qualm the problems and or issues that the neighbor, Levon Price, has brought up. If there's a filtration system that I've gone to look at and hear how it works, there would be no outside odors. There is no outside visibility. The indoor situation would be completely different than the outside, and that's why it wasn't brought up the first time when we went to the planning department, heard about the application that was being submitted as it was, but because I was denied, I have looked into other avenues to make sure that the neighbors are not bothered by anything that goes on my property.
Thank you, Mr. Jones. Planning staff, is there anything you would like to bring up or rebuttal on anything that's been provided so far?
Not particularly. It's Peter Maurer, Planning Director. The fact that the applicant proposes to have a limited cultivation site with indoor is not something that would typically be restricted as a part of a zoning amendment. Once the zoning is in place, then all the uses permitted in that zone would typically be allowed either by right or by use permit, depending on the proposed use. It sounds like, well, some communities use what is referred to sort of derisively as contract zoning, where say, okay, we'll approve it, but it's limited to the use that you're proposing. We don't really have a mechanism to control that, and so unless we were to say apply a plan development overlay and approve a plan development with the specific development as proposed by Mr. Jones, or somehow record some type of notice of restriction, there would be no way to restrict an owner from using the property based on whatever the zoning allows. I would not recommend that we try to do that. I think it creates problems down the road. It's difficult to track. So it's either, the land is appropriate for RA zoning or it's not. And I think that's really the decision before the board today.
Just in summation, what you're saying is even though he voices his intent to go to 24 plants and indoors, he still has the opportunity, if we were to get the permit put through, to move it up to 1 acre use on that property if that's what the ordinance says.
That's correct.
Okay. Thank you, Mr. Moore. I appreciate it. Is there any other board members? Okay, let's, I think that at this time, the next step is Ms. Price did make a comment. She has the opportunity for a serve rebuttal. If she would like to the answers that she received. If not, then we'll move on. I'll give Ms. Price the opportunity.
Chair Stopper, she does have her hand raised again. Ms. Price?
Now can you hear me?
Yes, we can.
Am I coming through?
Yes, ma'am.
Okay, good. The only thing else I have to say is I think it's very unfair to give somebody the right to grow something like drugs of any kind in a rural residential area. And we all knew when we bought up here that that's what this was, rural residential. And if you look at the map, you will see there's not very many pot farms around us, but there's a lot of rural residential. We're right next to M24. There's all the way down Sheep Ranch Road is homes, all the way up Sheep Ranch Road is homes. So stop and think about it. I feel sorry for Mr. Jones that his family is having health problems and everything. That's not my fault. That's not his fault, but he should not use it as part of the reason why he's doing the work he says he's doing. We still haven't seen anything going on up there. And if he's doing what he said he's doing, it must be very, very quietly being done. So please remember, this property can be sold and somebody else can use that zoning to change what they do up there and to affect all of us down here. Thank you again and have a nice day.
Chair Stopper, you are muted.
Thank you, Ms. Price. I'm going to bring this back to the board for questions of staff or the appellant and discussion. Oh, I don't see any hands up.
I'll go, Ben.
Okay, Mr. Garamendi.
Yeah, thanks, Ben. As this board understands, this is in my district. There's been a lot of conversation about this specific. Some of it is appreciated. Some of it was rather disappointing from my neighbors to hear how they spoke about each other, but that's neither here nor there. I'd hope we could continue in civilized fashion. We did the cannabis ordinance. We had there were a lot of whatabouts. What about are you going to do if this happens? What about this? Well, this is a what about. How are we going to handle it? I did take the time to watch the entire planning commission hearing. Madeline and Peter, I thought you did an excellent job. Thank you for your work on that. And thank you, my fellow supervisors, for your commissioners. I thought they asked good questions as well. What I walked away from that and from this hearing is that we were really stuck with a situation where we need to balance impacts. That's a judgment call that's very difficult. There was a part brought up by, I believe, your commissioner, Ms. Callaway, which was really the question of potential uses after we rezone. as Peter pointed out, we don't have the opportunity to do a contract zoning. So once we let this horse out of the barn, the horse goes where it's going to go. I thought hard about the other two zonings that we rezoned. I looked at those differently because of the fact that they had existing farms that existed under the 2016 urgency ordinance that were legal and permitted by this board, and that infrastructure had been built and existed. And I also balanced that with the fact that there are 2,830 other eligible lots that are currently zoned correctly in this county. So I wanted to take this opportunity to thank Madeline and Peter for their work and express what my concerns are and what my thought process was on this project.
Thank you, Mr. Garamendi. Any other board comments or questions? Okay, I'm going to go ahead and close the appeal hearing. And we're going to move on to board action. I will accept a motion if someone feels so obligated. Okay, lack of a motion. This dies for the lack of a motion. So at this time, I believe the appeal is considered denied. Ms. Edwards.
Yes, and please, Mr. Maurer, if you disagree with this characterization, feel free to speak up. But if the board takes no action, then the Planning Commission activity stands, which would be to not grant the rezone.
That's the way I understand it also. Thank you, Ms. Edwards. So with that, this item's closed. We'll move on to item number 18. Let me pull this up. Another item by planning, presentation of the general plan implementation annual work program and request for direction on priorities. So with that, I'll leave it to you, Mr. Moore. You're on mute still.
Yes, this is a discussion and hopefully we receive direction from the board on the general plan implementation annual report. I am trying to find my hold on just a second here. Trying to find my PowerPoint and in order to share it, and it doesn't seem to be. Oh, there it is. All right, so let's go back to the beginning here. Here we go. Sorry about that. So yes, this is the annual report to the board on the general plan implementation. It's required under Measure LU1A of the general plan. So we adopted the plan a little over a year ago. There were a number of implementation measures incorporated in the plan. I want to sort of reiterate the fact that implementing the plan is just as important as adopting the plan, if not more so. We had a total of 213 different measures that are incorporated into the plan, and of those, 90 sort of ongoing things that we intend to do. 27 of them relate specifically to the zoning ordinance update. The rest are things that we said that the county will do as sort of a one-time project. Obviously, we can't do all of those at once, and so the idea here is that we, bite off manageable chunks and set the priorities of what are the most important. The implementation of the general plan is handled by a variety of different tools. Some of the most important ones are, our ordinances that we adopt, primarily the zoning and subdivision ordinances, our capital improvement plans, that of the county as well as other agencies that provide services and infrastructure to the citizens of the county, and applying policies and measures to project review and approval. Last year, we had a similar discussion, and we identified a number of different projects that the board felt were the most important. I won't go through the full list here right now. I'll walk through each one of these sort of individually. But generally, the zoning map update and the zoning code update were really identified as the key priority items. Two others that the board and the planning commission identified as being fairly critical were the Valley Springs and Copperopolis community plans, incorporating those into the community planning element. And the only measure that actually had a specific time frame identified by the planning commission and adopted by the board was developing a greenhouse gas inventory and reduction program. So with the zoning map update, you had a presentation 2 weeks ago from our consultants. That is moving forward. We've got some preliminary drafts that we're reviewing internally already. A lot of work is being done on that. And so I'm really happy to see that moving forward as quickly as it is. The zoning map update is going to the planning commission in next month, will be before the board hopefully in March. And that will be to bring the zoning into conformance with the general plan, as well as eliminating the interim zones of unclassified and highway service. This has been posted for a little over a month on the county's website, and hopefully we'll be able to move that forward fairly rapidly. As I started to talk about the zoning ordinance update, that's moving forward. Two of the specific items that were identified in last year's presentation was talking about vacation rentals and special event provisions. Those we intend to include within the overall comprehensive update, but I think we'll need to sort of pull those out specifically during that process so we can get input from the public, perhaps from board members, as well as the industry itself, to make sure that we're going in a direction that is appropriate for the county. So those have been sort of incorporated into a single project of the code update. Again, that should be hopefully completed in a little over a year. Spring of next year, we should have that all wrapped up if things go smoothly. We adopted the Valley Springs policies incorporated those into the general plan in September, and the next one of the next projects will be to start with Copperopolis. We've had some challenges in moving forward because of COVID. Obviously, we can't hold community meetings very effectively. If we need to, we can go to Zoom type meetings, but I think that having meetings in the community themselves for things like this, particularly given the interest that the county has in Copperopolis and the citizens of that community, having meetings there, setting up an advisory committee is probably something that we want to move forward on. And so perhaps waiting until we can move back to some sense of normalcy might be appropriate. But again, that's waiting for direction from you on how you want to move forward on that. We've made really good progress on the greenhouse gas baseline and the reduction plan. Fortunately, CCOG had some money available and thought this would be something that we could work together, since it includes the City of Angels camp. So they're funding this program. We've hired consultants to begin this work. The inventory is underway, and then phase 2 would be the development of the reduction plan itself. The contract that CCOG has with the consultant is that it will be completed by the end of 2022. So that is moving forward. One of the other items, or two of the other items that were on the list from last year, was the update to the RIM fees and the traffic study guidelines that the Public Works Department wanted to update. The latter has been completed. Those were adopted last summer, and Working with Robert, he indicates that they're in the early stages of getting a consultant on to start the update of those fees. So that is in progress as well. We are just about completed with the farmland mapping program. This was started 2 years ago now with the Department of Conservation. The map has been completed. We adopted a definition for farmland of local importance a couple months ago. That's been incorporated, and we're now just waiting for the release of that map from the Department of Conservation. That will set the stage then to begin the next stage of this, which is coming up with a mitigation program for conversion of farmland if that were to occur with future development in the county. So that's another thing that's sort of on the list of priorities that now that the mapping is done and we have the baseline for what's there, we can start developing that mitigation program. So the last two items on the list are, things we haven't been able to quite get to yet. Looking at infill incentives, working with the Economic Development Department to, figure out how we can direct growth to, where we said in the general plan that we wanted it to be, which is, within our communities. And so how do we create a program that incentivizes developers to look within our communities to provide that economies of scale, walkable communities that we're looking for in this county. And the Oak Woodland Mitigation Program, the implementation measure calls for an overall program so that it's functional for the development community to come and say they know what they need to do. They've got oak woodlands on their property. They know how to calculate how that's going to affect their project. Right now, it's on a case-by-case basis, and so there's no certainty in any program that someone would know. So that needs to get going. We did receive a couple of comment letters. I think you got a copy of those from a couple of citizens as well as a local interest group. One was talking about open space planning. As part of the zoning code update, one of the measures is that we will create an open space zone. And I think that the commenter made a very good point is that, well, before just creating the zone, we need to look at an overall plan, identify what we have out there. Are there other areas that need to be looked at? And so you might consider adding, open space planning to the programs that the department should be working on. Another letter that you received was more specific about an individual's project and how the county incorporates or how the county addresses vacation rentals and lodging facilities. That will be addressed as a part of the zoning code update. I don't think it's that specific issue really it's too narrowly focused for this broader discussion today, but it's something that we will be discussing as we move forward with the zoning code. Finally, we received a letter from the Calaveras Action Project, the Planning Coalition, with a sort of a broad-ranging discussion on implementation itself and prioritization and commitment to time frame. I know that Mr. Infacino, who represents the group, is ready to speak, so I'll let him speak to that himself. So that's sort of a very brief overview of where we've gone so far, what our priorities are, continue along the same path that we have started on a year ago with the general plan. We've got a lot going on, but we've got a lot to do as well. So I'm open up to questions of the board members, or if you have discussion of other measures that you think should be added to that list of priorities, then now is the opportunity. Thank you.
Thank you, Peter. Board members, any questions or comments?
Ms. Callaway? I just have a comment. on the Oak Woodland Mitigation Program, I had a flashback. We started talking about that when Ray Waller was with us. Because Mr. Waller and I went to a workshop on how to preserve the oak woodlands. And here we are, whatever, 20-some years later, and we're still talking about it. So I'm glad it's on the priority list.
Yeah, just phenomenal work, Peter. You brought up a lot of, you already addressed most of my questions. Pressing forward, there's a lot to do with the implementation, and let's just keep moving forward towards success. So we'll give an opportunity for public comment now.
We do have Tom Infizio with his hand raised. Mr. Infuzio?
Yes, hi. Good afternoon, board members. My name is Tom.
Can't hear you too well, Mr. Infizino.
Can you hear me now?
No.
No?
No, you sound very distant.
Let me try with... Let me try with the computer instead of the... Wait a second. Do you have me unmuted as a telephone or on the screen? My audio is by telephone.
Do you want to try calling back on another number?
Sometimes I gotta flip my phone over because I got it upside down.
No, it's right side up.
I hear you better now.
Do you hear me better now?
Yeah, it's still a little faint, but I think it's good enough for everyone to hear you.
Okay. Again, good afternoon, board members. My name is Tom Infantino. I'm here on behalf of the Calaveras Planning Coalition. We encourage the county to complete implementation of the priority measures selected by the Board of Supervisors last year. We support Mr. Mauer's suggestion to add to that list the preparation of an open space plan. We encourage the county to substantially increase its efforts to secure funding from outside agencies to assist with these implementation efforts. Also, we encourage the county to complete a long-term work program paced to promptly implement the 2019 general plan update. We again request that if the county continues to use consultants for this work, then please make the draft list of these consultants available to public consultants. We encourage you to review our proposed schedule for implementation. That was attachment 6 in the email I sent yesterday. We also encourage you to look at the list of state funding programs that could assist the county in these implementation tasks. And that was attachment 7 in the email I sent yesterday. We hope that after the pandemic has passed, supervisors will hold a public workshop well prior to the board's next discussion on general plan implementation, so people from throughout the county can participate in this sort of conversation. Any questions?
Thank you, Mr. Vizino, and it's down the, I received your letter, I did read it. Mr. Moore, Peter, is there anything comment to that on the process and the suggestions?
No, I appreciate the fact that there is, potential money available through competitive grants for a variety of programs. Grants take a lot of time to implement. It's great that there is, the state has, money for certain kinds of projects. There's also a lot of strings attached to those often. challenge that we have, in a county like ours is, limited staffing availability to manage those grants. So where there are programs that are available that are aligned with the priorities that the board has set, then grants are great. One of the rules I learned many years ago was you don't let the grants drive the program drives the grants. And so where we have identified priorities, such as the greenhouse gas reduction program, and CCOG had grant money available to do that, then we took advantage of that. And it also helped that Amber at the COG is actually managing the funding for that, and so it's not something that I or my staff would have to do. We'll definitely be looking at funding possibilities as we move forward. I've got, money established in my budget for ongoing maintenance. Every year we look at that and, how much can we, squeeze out of staff and our own budget to move forward with these programs. As far as the Oak Woodlands, Ms. Callaway's comment, yes, it's something that counties have struggled with for many, many years in implementing state requirements. We intend to do it, because the alternative is that it's a haphazard approach, and we'd really much rather have a comprehensive approach to how we look at a lot of these things. There are a number of measures, particularly in the conservation open space element, that talk about a variety of different specific items, but they all really sort of need to fit comprehensively together. So that is something that I would definitely look forward to working on, but I'll have to pass that on to my predecessor or my successor in a couple of months.
Thank you, Peter. Is there any other further public comments?
There are no new public comments.
Thank you. With that, I want to bring it back to the board. Any discussion on priorities? This is, an action item, but it's mostly looking presentation and looking for direction on priorities. So,
I think.
Yes, ma'am.
I think we should stay the course and with the priorities that were presented by Mr. Maurer, and to keep changing them, I don't think it helps the county staff or what the goals are. I'd like us to stay with the priorities that we established a year ago.
Thank you, Ms. Callaway. Ms. Fullendorf.
The only question I have for Mr. Maurer is how do these priorities integrate with ag tourism as it changes in the future?
I'm sorry, how do they integrate with what?
How do these priorities integrate with ag tourism as we go into the future?
Agritourism, okay, I didn't hear that.
Yeah.
I think that obviously the zoning code is going to be very critical in ensuring that we have a robust agritourism program, working cooperatively with the economic development department, with the ag department, with the ag community and the tourism community is all going to be critical in making sure that whatever program that we have is workable and makes sense, unique to Calaveras County. There's a lot of similarities between zoning codes throughout the state, but every county has its own unique aspects, and I think we need to make sure that we balance all the needs of the community. We want to make sure we have a robust economy, but we also want to protect the interests of adjacent property owners where they may be affected by agritourism activities. So, a year ago or 2 years ago, maybe we had a series of workshops on agritourism that was sponsored by the Economic Development Department and the UC Extension. Came up with a lot of good ideas. I think we'll be looking at that very closely as we move forward with the zoning ordinance update to ensure that I know it's encourages the economic activity, but it doesn't make it so wide open that it adversely affects the properties. That balancing act that we always, have to address with most planning issues of, looking at what the property owner needs, how do you drive economic development, and, how do you protect neighbors? So it'll be addressed in the zoning code is sort of the bottom line.
Mr. Toffanelli.
Yeah, I just want to say I agree with Marie that we should just keep steady course where we're at right now. Trying to change things around or add stuff, it really wouldn't be productive at this point because the list is so long, and he's making progress on it, and his staff is, that I think right now we just need to move forward with.
Thank you, Mr. Toffanelli. Mr. Garamendi, any comments?
I believe we ought to continue moving forward. I agree with what what Gary was just saying.
Yeah, I would also concur with Ms. Callaway and Mr. Toffanelli. Stay the course, Peter. If anything arises, I trust you to bring it to the forefront if it needs to be the forefront. Let's keep pressing on. The implementation is important, and we just need to get every second out of you we can before you leave. Okay, thank you all. We're going to go ahead and move on to item number 19, boards and committees. The appointment of applicants to serve on various committees, commissions, advisory boards, and county service areas. I see on here that there is one committee with two applications for the same position of attorney on the Air Pollution Control Hearing Board. I'm going to go ahead and pull that one off to the side. And unless there's any, do any of the other board members want to pull any of the other appointments to the side for discussion? Okay, with that, we're gonna, I guess that then we can vote on it in its entirety after we discuss the one position and we ask for public comment. So it's the Air Pollution Control Hearing Board. One vacancy for a term expiring 12/31/2021. I think before we have this discussion, we'll offer the opportunity for the public to make a comment. If there's anybody online that would like to make a comment, please do so now.
I do have Mr. Infizio's hand raised. But I guess I want to make sure that's relating to this matter, correct?
He was sole on the item 18.
Okay.
I don't believe that he would want to comment on this. I know he would speak up now if that was the issue. Is there any, we'll give it another second.
Okay. Yes, I am not seeing any new public comments.
Okay, I'm bringing it back to the board. Let's discuss the Air Pollution Control Hearing Board position of attorney. We have a James Jones and a Thomas Myers. Mr. Toffanelli, please.
Yes, I would be in favor of Jim Jones. He was county counsel here. I've known him for a number of years. He's a very good attorney. He was actually COG's attorney for a number of years after he retired with the county. He's very knowledgeable and a very good attorney. So I would be in favor of appointing Jim.
Is that a motion, Mr. Toffanelli?
We were going to motion for all of them, but that's the direction I would if I would make a motion, it would include Jim, yeah.
Okay. Anyone follow up? I also read them. I did see that James Jones, had quite a bit of government experience behind them, and that's a good thing moving through this process. So personally, I would agree with you. Ms. Fullendorf.
I would agree with Gay. Working with Jim at COG for a number of years, I think he has an understanding of government and would be a good fit.
Excellent. That's three of us. Does anybody have anything else to say? Okay, Mr. Garamendi's in support. Ms. Callaway shaking a yes. So we'll go ahead and put James Jones on it, and all on the top of the list for attorney for Air Pollution Control Hearing Board. I'll entertain a motion for the appointments.
So moved, Mr. Chair.
Thank you, Mr. Toffanelli. Do we have a second?
I'll second.
Okay, motion by Mr. Toffanelli, second by Ms. Fullendorf. Supervisor District 1.
Aye.
Supervisor District 2.
District 2, aye.
Supervisor District 3.
Yes.
Supervisor District 4.
Yes.
And Supervisor District 5 is an aye. That passes 5-0 on the appointments. Our next item, Supervisor's announcements. In compliance with Government Code 53232.3D, board members shall provide brief reports on any meetings attended at the expense of the local agency and may make other announcements or report out. Anyone want to raise their hand?
Well, Gary and I were at LAPCO last night when we did the workshop on the municipal service district for the McCollum Hill Sanitary District, and it was really a good report.
Good news. They've been working on that for quite some time.
It's well worth reading.
Okay. I just wanted to say that I attended a Motherload Job Training Agency meeting yesterday. They're bringing in it's been passed on to Catherine Galino and the Chamber of Commerce that they're bringing in training for truck drivers into Calaveras County. There's a pretty good amount of money there, and we'll be able to facilitate people getting into the trucking industry with the proper training. And if people in the public are interested, please reach out to either Kathy Galino, Motherload Job Training, or our Chamber of Commerce, and they can direct you in the right direction to get into the program to get into these jobs. Mr. Toffanelli.
Thank you, Mr. Chair. Marita didn't bring up that we both attended the Central Sierra Child Support Agency meeting earlier in the day yesterday also. I just want to say that organization is well run. It's a very good organization, and the counties involved, Tuolumne, Alpine, Calaveras, and Amador, do a great job. All the supervisors there. It's a good board, and they're a well-run organization.
Excellent. Thank you, Mr. Toffanelli. With that, we're going to go ahead and close the meeting if no one else has anything to say. And thank you. It's a great day.